Viva isla sen para que todo tempo e paz para ita dan langit na bendisyon contra peligro na fan sa fuham Deus protege Island Guam contra peligro na fan sa fuham Deus protege Island Guam. Can you stay a while? I need to know.
Good morning.
If I should just let it
Off
go.
day, everybody.
If you need me,
The 611
I'll be
containing
there. When
COVID.
you need me, I'll be there. Can you stay
I want
a
to say
while?
good
I
morning
need
to our
know.
listening audience on 994 and, of course, our Facebook live audience watching from all around the world. Sabrina Salas-Mantonati, good morning.
Good morning, Chris Barnett.
And we have definitely got a full show for you guys this morning. There's a lot of information, so we're just going to get right to it with the latest COVID-19 results from the Joint Information Center.
Okay, the latest update pushed out last night, 9:55 p.m. The Department of Public Health tested 31 individuals for COVID-19 on Tuesday. 9 tested positive through Public Health and 19 tested negative. Public Health's overall count also includes 4 positive cases that were tested by the Naval Research Center in San Diego. That brings the total number of confirmed positive cases of COVID-19 on Guam to 69. Meanwhile, on Tuesday, the governor, during her press briefing, made the tragic announcement that Guam recorded its second casualty.
He had colon cancer and a traumatic spinal injury. He presented
At
GRMC
GMH,
with the
our
fever,
main
but no
goal is to
travel
isolate all our COVID positive patients into contained units. No patients are in contact with each other. The emergency room.
A lot of people are out of work, been laid off. I would think that if they had a choice if they had to pay rent or buy groceries, they're going to buy groceries because we've got a moratorium on evictions. But it will likely take more than just a few weeks, realistically, for money to come down from the federal government. Is there any local funding that's being planned to help? These folks between that time?
Yes, so Nestor, we do have public services right now. We have food stamps that they could qualify for. We have
that Guam's second COVID-19 related death occurred at the Guam Memorial Hospital. The patient presented at the Guam Regional Medical City on March 24th and was then transferred to GMH, where he remained in isolation throughout the week. He was 79 years old with underlying health issues which were compounded by COVID-19. The patient had no recent travel history, but initial investigations indicate the patient may have contracted COVID-19 from community contact. In national news, President Trump has already extended social distancing guidelines through the end of April. Now, the White House is preparing to let Americans know what is expected from them in order to flatten the curve of new cases. The White House says it will unveil new details about extended social distancing guidelines today. The president says they may be even a little tougher. Trump saying this is based on modeling that shows the peak in fatalities will not arrive for another 2 weeks. The same modeling also shows that by very vigorously following these guidelines, we could save more than 1 million American lives. The models, which the White House plans to release today, shows an increase in cases and deaths, even with social distancing in place. Members of the coronavirus task force say they are looking at asking Americans also to wear masks. The White House is touting 1 million tests have been performed for the coronavirus in the U.S., but in a conference call, some governors warned more testing is needed in rural areas. The FDA, in the meantime, has approved a new test which can detect coronavirus in at in as little as 5 minutes. CBS News, in the meantime, is reporting that the captain of the aircraft carrier USS Theodore Roosevelt sent an urgent memo to the Navy asking for help in addressing the spread of the coronavirus among his ship's crew. Captain Brett Crozier wrote that decisive action is required now to comply with Centers for Disease Control and Prevention guidelines and prevent tragic outcomes. In a 4-page unaddressed letter, Crozier suggested most of the 4,000 crew members should be removed from the ship and put into 14-day individual quarantines in keeping with the CDC's recommended guidelines for preventing infection. 10% would stay on board to sanitize the carrier and run the reactor, which he called a necessary risk. In peacetime, he argued, it was the right thing to do. Quote, "We are not at war. Sailors do not need to die. If we do not act now, we are failing to take care of our most trusted asset, our sailors." A defense official told CBS News that the number of people on the Roosevelt who had tested positive for the coronavirus was in the high 70s, and that was as of yesterday morning. It's a figure that has likely increased. The carrier, as many of you know, is docked in Guam. In the letter, which was reported by the San Francisco Chronicle, Crozier told the Navy that the close quarters on the warship mean that sailors cannot follow proper guidelines for quarantine and social distancing. Quote, "The spread of the disease is ongoing and accelerating." He pointed out the inherent limitation to test for the virus, which he said cannot definitively prove someone isn't carrying it. Crozier said that of the 33 sailors first diagnosed with COVID-19, 7 tested negative, but within 3 days were showing symptoms of infection. Those sailors, he pointed out, would end up infecting other sailors because they were reintegrated into group quarantine sites after initially testing negative. When the first sailors tested positive last week, the immediate suspect was a highly publicized port call the Roosevelt had made in Da Nang, Vietnam. 15 days before the first positive test, the chief of naval operations said last week in a briefing with reporters when the Navy made the decision to let the Roosevelt go ahead with the port call, there were 16 reported cases of COVID-19 in Vietnam, all of them north of Hanoi, which is north of Da Nang. Whether that port call is the culprit is a matter of debate, since people were flying off and onto the carrier after it left port. Crozier identified the elements on board and inshore accommodations that pose a COVID-19 threat to sailors. Their confined quarters and workspaces, open berthing, shared meals with large numbers of crew, consistent close contact and movement around the ship that requires close contact with people who've been exposed to the virus. And again, that was a letter written by Captain Brett Crozier with the USS Theodore Roosevelt.
So he is a captain who's with, I know you just said it, but my mind is just kind of blown because the captain of the Theodore Roosevelt is basically begging the federal government and the Department of Defense
for help.
Yeah. And I just find it ironic that we have to go all the way around the world to the national media to find out what's happening with this ship right here on our island. And the response from the governor is, go ask the admiral. The response from Linda DeNorsi, that was yesterday?
Yeah.
Was go ask the admiral.
Yeah. And just so people know, we've been saying this, there are 20 sailors on board that ship that are originally from Guam. So they have families here and they're wanting to know what is going on that ship. And we apologize that it's been so difficult to get you the information, but, we've been trying. And this is a report that was on CBS News. It was carried in the San Francisco Chronicle. I woke up and I saw this, and we actually have this report. It is on I think the link is on our Facebook page, which you can read. You can read the story, and then they also posted the letter that Captain Crozier wrote. Nestor Lecanto, he's already starting to work on this. He's reaching out to Joint Region Marianas. Hopefully they can provide additional comment.
Yeah, so, wanted to share this with our listening audiences. We have been trying to, because they keep saying, go ask the admiral, go ask the admiral. And we have been trying to ask the admiral. I mean, just yesterday, Nestor sent off, I'm going to go ahead and read the questions and the responses. Thanks. Wow, you're prepared. So these are questions that we sent to Joint Region Marianas asking about the USS Theodore Roosevelt. And, of course, we did this because our local government, as I don't know if they think it's top secret or they don't want to make the admiral mad or what the real deal is, but so we did send these questions to Joint Regent Marianas. What is the latest number of positive cases for COVID-19 among the sailors on the Roosevelt? The answer from Lieutenant Rick Moore of Joint Regent Marianas: to protect operational security, we are not disclosing any specific numbers of sailors with test results indicative of COVID-19. The Navy has been and will continue releasing totals of positive cases of active duty sailors and Navy civilians daily. You can view the latest updates here at Navy.mil. Second question: are the results being reported to the Guam Department of Public Health? The answer: Joint Regent Marianas has been and will continue to stay in constant contact with Governor Leon Guerrero regarding the progress of COVID-19. So I guess that's a no.
Right.
You got to really put your thinking cap on to decipher these military answers. It's quite an art form to answer a question with words that form sentences that don't say anything. Here we go. Question 3: how many more service members require testing, and when do you expect to complete it? The answer again from Joint Regent Marianas: I won't go into specifics about testing due to operational security concerns, but we continue to test sailors in order to prevent the spread of COVID-19, to ensure the health and well-being of the USS Theodore Roosevelt crew, and to maintain mission readiness. Next question: is it true testing is being done at the U.S. Naval Base Guam gym? The answer: it's the same answer as the previous question. I won't go into specifics about testing due to operational security concerns, but we continue to, well, you get the point. Fifth question: are there military personnel or civilian contractors providing services on the Roosevelt? Are they required to wear personal protective equipment when in close contact with Roosevelt personnel? The answer from Joint Regent Marianas: Naval Base Guam military personnel provide food, water, and supplies to the Roosevelt sailors. During these scheduled deliveries, there's no direct contact or interaction between Roosevelt sailors and Naval Base Guam military personnel. Medical reps charged with evaluating symptoms of those who have tested positive are wearing appropriate PPEs. So there you go. The response from Joint Regent Marianas. And I wonder, Bria, that it hasn't been a good COVID for the military.
No, I mean, if the numbers are over 70, I mean, we're 69 today.
Right.
And that's
the whole island.
Yeah.
And we're talking about 70 positive cases. Like the letter from the captain said, the close quarters on that ship don't allow for the meeting of CDC guidelines about self-quarantine and social distancing.
And I mean, I don't know what kind of facilities they have on Big Navy, and if they need to move them out and quarantine them, each one having their separate rooms.
Right.
You're looking at over 4,000 rooms that they're going to need.
So what's going to happen is sooner or later, the Navy is not going to be able to keep a lid on this.
Yeah.
And we're already seeing it. There was a Facebook post that I saw. Someone had said that they had seen sailors, and that there was a possibility that the old McCool School in APRA was going to be used as a quarantine facility.
I don't know if that's going to fit 4,000 either.
Right, but I'm
not
saying,
sure,
so they can't fit everyone on the base. I mean, logically, they're going to have to go outside of the base and look at their footprint and figure out where to store these guys. So I want to put in a call to Santa Rita Mayor Dale. And find out, he knows what's going on in his village, and see if he's heard anything or seen anything.
Okay, yeah. And again, if you want to check out that story that CBS News has on the letter by Captain Brett Crozier from the USS Theodore Roosevelt, you'll find the link right now on our Facebook page, including the story and the letter. And also just at Joint Regent Marianas, they issued a press release yesterday. JRM, Anderson Air Force Base, Naval Base Guam have all set Health Protection Condition C, HP-Con C, and that is in accordance with U.S. Indo-Pacific Command Directive. The move to HP-Con.
You got to be like the governor. You got to say Indo-PACOM.
Indo-PACOM. It formalizes many of the COVID-19 prevention and mitigation measures that Guam-based military installations have already put into place over the preceding weeks. They put an FAQ together. What does it mean? HP-Con C is defined as an elevated risk of sustained community transmission. people have been infected with the virus, but how or where they became infected may not be known, and the spread is ongoing. What can you do? Continue to wash your hands, use hand sanitizer, cough into your sleeve. Do you know the deal? Practice social distancing,
Right.
social isolation. Anderson Air Force Base and Naval Base Guam continue to evaluate and reassess base policies in order to mitigate risks and prevent community transmission of COVID-19. And that is from Joint Region Marianas about HP Con.
Right. There was something lower down in it. I don't know if we had the same copy about how this is going to affect people's ability to go to the commissary.
Oh, that's the longer press release. This
Right.
is the one I actually pulled off of their Facebook page.
Right, and
The
so
press
this
release
is
they have is,
this
yeah,
is
it's
going to
really long.
affect. Remember, there was how one of the first sore points with the military was how they limited access to the commissary, to the exchange for Guam National Guard members who weren't on Title 10, which is basically pretty much all of them. And also retirees, Manamku dependents. And they were basically like, yeah, you guys get Saturday and Sunday. And what we've seen in videos from that was that the line was crazy. We're looking at our elderly who are the most
Waiting in
vulnerable,
line. Yeah.
right, to COVID-19, waiting outside in, like my grandma would say, the hot sun.
If my dad was here
Oh, boy.
living on island, he would go ape,
Right.
Right.
Right. And so what happened was after these videos circulated, there was so much public backlash. I feel that was the reason why they kind of went back and they said, okay, we're going to give you Friday too.
Yeah, that's pretty much it.
And so the videos came out last Friday. It was almost worse. The video I sent to the chat that we reported on, this line was like stretching. It looked like over a mile.
Yeah, it's pretty long.
And so now these hours are going to be further affected and the access. So what does it say?
Respect the 60 years and older operating hours Friday, Saturday, and Sunday from 10 a.m. to noon. For the Arodi Commissary, 9 a.m. to 11. For the NEX main store, people 60 years and older, people with disabilities that require assistance will be authorized exclusive shopping privileges. That's pretty much.
So they're doing kind of like a Manamku hour thing.
Yeah, a couple of hours, right? Yeah.
Yeah. So get there early. I don't want to say you might have to show up the night before and camp out to be in front of the line, but so that's definitely one of the effects. But let us know when you guys go out to the commissary and they're now in HP Con Charlie.
Is that what it is?
That's what it is.
I was saying it all.
Yeah, Health Protection Condition Charlie. Like we know what that means. You know what I mean?
Charlie stands for C stands for Charlie.
Right. Yes. And
Okay,
so
all right.
I don't know if it goes up from C, like there's a
D?
HP Con Beta or
I don't know.
Equa. I don't know. 627. Sorry.
There's something going on that we need to pass out what's happening in Saipan.
Okay, yes.
And we got this late yesterday to Mas Minglonia, the Commonwealth Ports Authority, the governor's office, informing the public that mail services. Actually, let me go to that at the request of CNMI Governor Ralph Torres, United Airlines agreed to suspend all flights into and out of the CNMI from Guam effective April 6th through the 30th. With 2 confirmed cases in the CNMI, continued inbound arrivals, however limited, diverts desperately needed resources away from addressing our immediate need to contain the further spread of COVID-19 in our community. They're also still waiting on the confirmation on the suspected COVID-19 death. This is to give the public notice that the last flight in and out of the CNMI from Guam will be this Sunday, Thursday, April 2nd. UA flights have been canceled. If you must return or leave the CNMI, make your travel arrangements immediately by contacting United Airlines at 1-800-864-8331. Also, the U.S. Postal Service, air shipment of cargo to and from Guam, and medevac transport for health emergencies will not be disrupted by the temporary suspension of the Guam CNMI United Airlines flight.
Wow, that escalated quickly. It started with their first suspected COVID-19 death. We haven't got the confirmed results, so I'm
Not
wondering,
yet.
with public health, we talked to Linda yesterday. She said we're going to dedicate 5 slots for the CNMI. We know that they were waiting on 11 test results. And so last night we ran 30 tests, and I was kind of doing the math in my head. We ran around 30. There's some discrepancy with the numbers that we're going to talk about later. But I was doing the math in my head, and I wonder if the other 10 tests, because Linda had said during the press conference, we're running 40 tests. That's that.
Yeah.
So wondering if those 10 tests that we didn't get results for, if that was for Saipan. And so, Tomas hopefully will track that down for us.
Yeah. And just people are clear that, Guam is the regional testing, I guess, facility. So we're testing for Palau, FSM,
Right.
CNMI.
But Linda did say that we haven't got samples from those places yet.
Right, but the Palau government, they say they have their own. They have a suspected case, and they're asking everybody in Palau to just remain calm, and they're waiting for the test results.
Right, and also Yap, I believe. I was talking to Victorious, and he was saying that they've also instituted quarantine measures. So, I want to go back to this thing with the CNMI governor. Basically, what happened was he asked United Airlines to quit flying from Guam to Saipan. Which right away it clicked in my mind. I went back to when the people, the doctors, everyone was asking the governor to stop flights coming in and out of Guam, and the response was that she didn't have the authority. And I know it's a different world now, even 2 weeks later with COVID-19. But I kind of thought, wow, the CNMI governor made it look easy. Like all he did was ask the airlines, "Can you stop flying in?" And they were like, "Okay." And so all this time we were the governor doesn't have the authority. The governor doesn't have the authority. Maybe we were thinking too big and expecting her to ask the FAA. Maybe we should have thought smaller and, could have asked the airlines. I mean, I don't know. It's too late to go back. And I was kind of thinking this morning with everything that's happening with this COVID-19 response, there are things to be critical about. But, in the media here, we can pull on a string and unravel the whole sweater. And meanwhile, important information that the public needs to know is passing us by. So we're trying to balance everything. It's pretty, it's quite a balancing act, let me tell you. So
a lot of deciphering of
deciphering
of the COVID code talking.
Yeah, it's COVID code talking. So the press conference yesterday, and I just got to say our condolences to the family of the second COVID-19 casualty. I mean, it's just terrible, and Dr. Jolene Nugget in the press conference was saying things like they had put the patient on a morphine drip, and that the family was aware that the patient was in comfort care. I think that this was obviously the plan they had laid out for the end of life care for this patient. But remember, when we talked to the family of Doring Jesus, she was held in isolation and was not able to see her family, and so she died alone. I mean, we're thinking maybe there was nurses there, and so. You have to remember that when we're talking about this man who died, I mean, if you think about his family not being able to see him, not being able to say goodbye, I mean, that's something that, it's a little bit sterile, the way they discussed the man's death in the press conference yesterday. And I know that, to me, it kind of seemed like there was a lot of talk about the pre-existing conditions that he had. And again, this is why this disease is so deadly for the elderly, is because they're living with these conditions. And this patient had colon cancer, right?
Yeah,
and a traumatic spinal injury. Okay, well, think about those with diabetes, which is, more common. And we've talked to many doctors on this show, and they say that, those with diabetes who go to dialysis are very, very susceptible and vulnerable to the effects of this virus. Yeah. Hey, we got to do news at 6:33. We're supposed to get the Adjutant General on the show. We're going to go to Saipan with Tomas Maglotnia, and I really want to unpack the governor's response to questions yesterday at the press conference about what the government of Guam is doing to help our people who need help, not 3-4 weeks from now. They need help right now. They needed help yesterday. And so we're out there asking the questions, and we're going to give you the answers that we got later on in the show. So it's 6:34. Again, thank you to our Facebook live viewers. And we'll do news now from the KUAM News team. Again, it's containing COVID. The KUAM News takeover of Guam's favorite I-94.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
I'm Jonah Goncharfris, Senior Producer for KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home. To protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home. Make sure you wash your hands. Practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you. Stay safe and stay home.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Miss our daddy, Specialist Joshua Manzanotnia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Let us help you celebrate those special people in your life on the Cold Stone Birthday Club. Weeknights on KUAM News Primetime, KUAM News Weekend Edition, and KUAM Radio. One lucky celebrant will receive a birthday cake from Cold Stone Creamery every week, and their lucky nominator will receive a gift certificate from the Cold Stone Yogurt Dessert Bar as well. Visit KUAM.com to register your celebrant's birthday. You must also send an email with the name of the celebrant and their date of birth, as well as a single close-up photo to birthdayclub@KUAM.com. All submissions must be compliant with KUAM regulations and must be received 2 days prior, but no later than noon Chamorro Standard Time on the day of the birthday on weekdays, and noon on Friday if a weekend birthday. See KUAM.com for additional regulations.
The Birthday Club is presented by KUAM and Cold Stone Creamery and Yogurt Dessert Bar.
Off it, everybody. I'm Sabrina Salsmatinani.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Dear people who haven't had a Big Mac, who saw millions of people enjoying something and said, no thanks. We're not giving up on you, because today is a new day. A day for a burger that has a bun in the middle because it can. A day for a sauce so special they put it on there twice. A day for McDonald's most McDonald's burger. So go, because today's your day for a Big Mac.
Now available in 3 sizes, including the new Little Mac and Double Big Mac burgers at participating McDonald's.
Tune in to I-94 FM Monday through Friday from 6 a.m. to 6 p.m. as we talk up TV8 and TV11 primetime highlights of the day. Proudly presented to you by Docomo Pacific. Better together.
Banners.
Subway's got fresh choices for this Lenten season. Sink your teeth into the savory goodness of our shrimp and guacamole spinach wrap. Or go green with our delicious Veggie Max, a delicious vegetarian patty, free of artificial colors and flavors. Don't forget the classics like the tuna or seafood sensation subs, all made with freshly sliced vegetables, prepared daily in every restaurant. Visit any of our convenient locations today. Subway, make it what you want.
Can you guess what the most common disabling disease is for people ages 15 to 49? It's migraine. Are you surprised? Show people with migraine some support by participating in Shades for Migraine, a fun awareness campaign from the Association of Migraine Disorders. If you know someone with migraine, show them you care. Wear a pair of sunglasses on June 21st and post a photo with hashtag Shades for Migraine. Visit migrainedisorders.org to learn more. That's migrainedisorders.org.
This message is brought to you by the KUAM Care Force.
All right, containing COVID, KUAM News, Serena Salas-Mantonani.
Good morning, everybody.
Chris Barnett, good morning. I was thinking this morning, yesterday, I feel is one of the worst COVID-19 days. We had a death, a tragic death, and then, of course, 9 positive cases, 9 more cases, bringing the total to
69.
Yeah, and so,
that's inclusive of 4.
4 that were tested at San Diego and Encina Naval Hospital. What it's not inclusive of, though, is the alarming number of positive cases on the Theodore Roosevelt that we're having to go to the national media to find out about. And the Admiral, they keep talking about the Admirals. I just feel like we're at the point where we need to hear from the Admirals.
Yeah.
I feel like, they talk about having an us and them divide. And, I'm pretty sure they watch the news. I'm pretty sure Admiral John Manoni is seeing the governor, pass the buck to him. And is hearing the public health director pass the buck to him. So, I was the Admiral.
And I know that they're talking about operational security. Is that what they're saying?
Yeah,
and in the meantime, you have the captain of the ship saying we're not at war.
Right.
We need to save lives here. And we're talking about the sailors. Here
Yeah.
it is. We are not at war. Sailors do not need to die. If we do not act now, we are failing to take care of our most trusted asset. And, they're... I think he wrote that the number of cases in the high 70s.
Right.
More than, if that's true, that's more than the number of cases that we have just outside the fence.
Right. So we're going to talk to some doctors about this, find out what the local doctors are thinking about it. And talking about local doctors, someone we haven't heard from, alarmingly, very surprised we haven't heard more from the Guam Memorial Hospital medical director?
Yeah, she's the medical director.
Annie
that was
Berdalio.
That was the first time I saw Dr. Berdalio.
Maybe
at the
she
press
was
briefing.
in self quarantine or something. Yeah, but she hasn't been attending these press conferences, and it was kind of interesting because in asking a lot of questions about GMH, a lot of the doctors were like, "Why don't you guys get the medical director?" But she was, not accessible, and everything's kind of going through Lillian.
I think Dr. Jolene Uggan, in one of the press briefings, Dr. Mike Cruz, who's the governor's chief medical advisor and the surgeon
state surgeon
for the Guam National Guard. He actually had introduced Dr. Jolene Uggan as the medical director.
So maybe there was, I don't know, but Annie
Maybe she
was
was acting
Okay,
medical
so
director.
Dr. Annie Berdalia was introduced as the medical director yesterday at the press conference. And we're going to go ahead and play this clip here.
And this is basically, she's describing the situation at GMH.
At GMH, our main goal is to isolate all our COVID positive patients into contained units. No patients are in contact with each other. The emergency room is receiving one patient at a time. Each patient is screened in separate areas outside the facility and then individually placed in appropriate units. Nobody waits in a waiting room and mixes with anybody else. We have the capacity to isolate 36 COVID positive patients at the main facility, and we have 60 isolation beds up at the SNF. Currently, we have 10 COVID positive patients in the GMH facility. We have 9 up at the SNF, and we have 2 in the ICU. We have patients that are particularly vulnerable in our facility. These are non-COVID patients who are ill. Our first order of business is to move them out of the hospital. We have SNU patients that are elderly, and we are in the process of moving them out to other places. GRMC is in daily contact with our nursing staff to move out the other ill patients from the ICU, the telemetry floor, and the med surgery floor. The limiting factor is really our healthcare staff. Trying to move them to where they are needed so that we can create capacity is our number one goal. They, along with the elderly, are really the patients at most risk. So getting them the equipment that they need to take care of these patients has been our number one priority. After we move these patients, we have more capacity than we have staff. There's been a lot of talk about moving the MCH areas. Those are our labor and delivery units, our pediatric units, our neonatal ICU units, and nursery. Fortunately, the experience has been that these are patients that for some reason aren't as vulnerable. So although we are making plans to move them, we want to move the other patients first. It is a trying time right now, and there's a lot of fear out in the community. The best recommendation is to talk to your family via FaceTime. I FaceTime my mom every few days. Don't gather. Don't come to barbecues. Don't go out. If you stay home, that is your best bet. I'm an OBGYN by training. I still take OB call. So my patients come and have to deliver as well. The L&D unit and the OB floor, as well as the nursery, just by the design of all hospitals, is away from any infection unit. Every day of every year, we have infection patients in the hospital. We have tuberculosis. We have highly contagious viruses we don't even know about. Those patients always go to isolation units away from the L&D. So when you come in as a pregnant patient in labor, you are screened just like everybody else, because you could have COVID-19 as well. And just because you're pregnant, we can't assume you don't have it. So we require you to enter the hospital just like everybody else. You get screened, We go one at a time. And if you don't meet any risk factors, you go straight to the labor and delivery. Patients that we have not had a COVID positive pregnant patient yet, but we do have plans to isolate them and deliver them as well. Our main concern at the hospital right now is to get these elderly people to where they can be cared for. And that's how we're creating capacity.
Memorial Hospital talking about what's happening with GMH and how they're trying to move out the elderly patients out of GMH because, as we have been told, GMH is the COVID hospital, GRMC is the non-COVID hospital. So they're trying to move out the elderly patients that are at GMH that are non-COVID over, I guess, to GRMC to open up bed capacity there. And also she'd mentioned briefly about the movement of the maternal child care division, that's the labor and delivery, the neonatal unit, and she was talking about how they're not as high risk, I guess, as the elderly patients. So first priority would be to move the elderly patients out of GMH.
Right. Bree, was there, like, in Dr. Berdalio's statements, was there anything that she said that kind of contradicted information that had already been released about the skilled nursing facility?
I think she mentioned the skilled nursing unit, but I think that was that they moved them from the SNU to GMH. And so now they've got to move them again to GRMC. That's what I think she meant. I don't think, I'm not sure if she meant they were still at SNU, because SNU now is supposed to be for the for isolation.
Right. So where are we with the moving of the maternity ward? Were you able to decipher?
That's what she said. She said that, the first priority is to move the elderly patients out of GMH. And then there are plans about they're making plans for the, is it maternal child?
It's pregnant ladies and babies,
okay.
Basically,
yeah,
if you
let's
want to
just
use
call it
layman's
that, so we
terms.
don't have to be so technical.
Right. What is the holdup, though? All the doctors are saying the priority, when you're in a war, who gets taken care of first? I mean, I understand we're taking care of the elderly, but women and children, you know what I mean? Mm-hmm. All the doctors are saying consistently that that's got to be a priority. We got to move the women and the children out of the Guam Memorial Hospital. It's part of the pandemic plan. GRMC is supposed to be the COVID-free hospital. And all we're hearing from the government is that it's complicated.
Yeah. But I didn't even know that the Minonko weren't even moved out yet. So that's why they're saying, because the Minonkos are our most vulnerable population.
Right.
So I could see where they're saying that we got to move them out first. I just didn't know that they weren't moved out of there yet.
Yeah. So
now they got to move them. Then they got to move the pregnant women and the babies out of the COVID hospital.
Right. So let's go to the phones. I think we have Dr. Hoan Wen of the American Medical Center. Doc?
Hello, Doc?
Okay, nope. Maybe not. I'm going to try and get a hold of him. 653. What else we got going on the show this morning? Well, there's just so much, right? I mean, there's so much. We're really trying to dive into this Theodore Roosevelt stuff. Yeah. There's that. There's, are we moving the pregnant ladies out of the hospital? There's also the commercial testing. So yesterday they announced the commercial testing for COVID-19 is available.
Mm-hmm. Try and find that.
Right. And so I heard from a doctor last night who said that there hasn't been any regulation, any guidance given to insurance companies, to healthcare providers about what happens after these COVID-19 test results are received. Mm-hmm. You know what I mean? Because it is a public health epidemic, so public health has to be involved in some way. And I know Linda at the press conference yesterday had said that they would be tracking and monitoring.
And it takes a few days for the results to
right.
come back.
Yeah,
it's not the same as if they went to GMH, because not GMH, public health, because public health is only doing the limited priority group of people. And, I want to say, I think it looks like they extended that, but to more than just the initial 4.
Right. But the problem we were hearing is that they announced commercial testing is available, but the legwork wasn't done to stand it up properly. So the clinics received a flood of patients yesterday who wanted to get tested for COVID-19, but according to the one clinic and one doctor, they weren't tested because they don't know who's going to pay for it. They don't know how it's covered. They don't know, you know what I mean? So
yeah,
I know they thought that was going to get off the ground running, but it looks like it fell on its face yesterday.
And it says Public Health announces effective today, which was yesterday,
right.
Commercial testing of COVID-19 will be available through diagnostic laboratory services. Healthcare providers can now refer specimens from patients who do not meet the criteria for priority group testing directly to DLS. COVID-19 testing is covered under Medicare, Medicaid, and MIP. If you have mild illness and want to be tested, contact your healthcare provider.
Right. So apparently the healthcare providers didn't get a heads up is what we're hearing. So, hey, welcome to the party. You're oftentimes the last to know. 6:55. Bree, can we do news? And then we're going to get some people on the phone. Also on the way, we've been getting a lot of questions about Rev and Tax.
Yeah.
And we're going to get the director, Daphne Shimizu, on the phone to kind of bring us up to speed on what is up with that department, right? Taxes
have been the deadline has been extended, but there's just people have been calling about driver's licenses,
right.
Things like that. So it'll be good to have her on.
Yeah, and we're going to get her on. So you keep listening. 6:56, containing COVID, the KUAM News Takeover on Guam's favorite I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together. This war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times. But make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers. And you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
soon, 'cause I am here for a reason. Sometimes in my tears I drown, but I never let it get me down. So when negativity surrounds, I know someday it'll all turn around, because all my life I've been waiting for, I've been praying for the people to say that we don't want to fight no more. There'll be no more wars, and our children
Fantasia.
will play one day, one day.
One day this will all be over, but it's not today.
One day, one day, one day.
The first day of April, Wednesday, 2020, containing COVID. Good morning. There's a lot going on. Thanks, you guys, for watching our Facebook Live stream. If you could, share the broadcast, get the info out there. There's a lot of info always. And we kind of like separate everything later. We throw it on the YouTube, but, you know, get the info in real time. 7 o'clock, KUAM FM, Magotny, Guam. Comments. Ken St. Nicholas from our Digital Hit Squad team.
Good morning.
What's up, Ken?
I'm going to work on that next time.
Need a better title.
I know.
Digital Hit Squad team.
Digital dude.
Try to throw everything in there.
I know. Okay, so we have comments here. What are some of our comments this morning?
A lot of people concerned, of course, about the USS Theodore Roosevelt. Kinet Kamtai has another question, though. She asks, can you please clarify if the landlords can still evict as long as we are still under the public health emergency? I'm confused.
Yep.
When the governor said she will not have no rent suspension, I think I don't know if we played that soundbite today.
I'm going to play it. I'm going to dedicate a lot of time to that. Don't worry. I'm very upset by it.
It's coming.
I'm very upset by it. Just real quick, ma'am, do you still got to pay your rent? I don't know. The governor was kind of shifty about answering that question in the press conference yesterday. She basically said, oh, well, if they can't evict you, then that's basically meaning you don't have to pay your rent. But I already got the notice from the landlord through the realtor. They sent it just like they always do. You know, they sent it a couple days before the first, and it's like, hey, reminder, rent is due. And so what kind of situation are these renters now facing? I mean, the governor is putting them in this position where they got to tell the landlord, like, oh, well, you can't evict me. And the governor said you can't evict me. So so it's a tough situation, and really expect more compassion from our government officials. You know, the responses that we're getting, a little too detached for my taste, and I don't know if they just don't get it, or I don't understand. I mean, people are hurting out here. People have drained their savings to stock up and prepare to stay at home in these mandatory social isolation orders, and to tell them to just hang in there, while Uncle Sam figures out the assistance, which is going to come in weeks. We're talking weeks, not days. Not hours. The senators, they got to
go into session.
They can't go into session because the governor got mad. So they're not going to give you any relief. So we're basically.
And now some of the senators are mad because they can't go into session.
Right. They should all be mad. They should be. I don't understand why the senators aren't mad. It's like they're cool with it.
Well, the speaker, what did she say in her response? That I'm going to be holding a conference call with the White House Office of Intergovernmental Thingamabob, whichever group. In D.C., and colleagues, come and join me.
Right, so she's going to do a Zoom. It's going to be by Zoom. What other comments we got there, Ken?
Annie Takenko concerned about the Theodore Roosevelt. I was watching something, and they mentioned that a sailor aboard the carrier that docked here passed away of COVID-19. We don't have that type of information. But also, Rick Perez. There's so many comments here. I'm trying to find it. Chris, you made good comments about the Roosevelt. If I may add, Menoni was probably ordered to stand down because the command and control messaging is at the 4-star level and above. In other words, this is a chief of naval operations and secretary of the Navy problem.
Ooh.
The admiral is constrained in
above his pay grade.
Yes,
wow.
in his ability to share information.
How do you go above the admiral's pay grade? The admiral got to be feeling really small this morning.
Is it the chief of naval operations Facebook page? He delivered a message just trying to assure everybody, not just the Roosevelt, but just all of the sailors and servicemen in the military, that we're going to be okay. We were prepared, and we've been training for this kind of events. Not this, but for disasters. I was going to give it to you so we could play it. But
Right.
you know, when I saw everything going down with the Roosevelt and the letter, I was like,
Right.
no.
And
I think,
with the
should focus on this.
I think one of the huge developments. I'm getting the story. We pass it around early. The story. It's so funny when you pass around a story and then it comes back to you. It's that WhatsApp boomerang.
Mhm.
Where you're like, people are sending to you like, hey, I'm the one that sent this out, and thanks. So one of the big developments, I think, is that the captain on the Roosevelt wrote a letter, a very, very strongly worded letter, a cry for help, and this is coming from within the ranks, and it's not from some, lowly mess hall sailor. This is coming from the captain of the Roosevelt. Go ahead, Ken.
Oh yeah, and we just have tons of comments about that. Some comments about the hospital. Jose Akimasal is asking vital statistics. Is that shut down? I heard it is. Just a lot of misinformation or just tons of information coming out. And people just need to know what's true and what's false. So.
Right. Okay. 7:05. Let's get Santa Rita Mayor Dale Alvarez on the show. Good morning, Mayor.
Good morning.
How you doing over there in Santa Rita?
So far, so good.
Mayor, we just wanted to touch base with you because obviously you're neighbors with Naval Base Guam. What have you heard about the Theodore Roosevelt and the quarantine measures that are being done, hopefully inside the fence line?
Well, so far what I've been hearing is there's some rumors saying that they are quarantining the sailors at that old McCool School. And I've passed by there, but I haven't seen any kind of activity. But then some say it's when it's traffic up there, that's because they're getting in line to pick up their lunch at Southern High. But so far, I don't know anything what's going on. I haven't been informed.
And are you normally informed by the admiral and the naval base, Mayor, when they're doing something that involves the village?
Well, not the admiral, but the CEO of Naval Station, or they'll inform me what's happening or what's going on or what they're going to do. But I haven't been informed about this virus yet.
Okay, and so I told you we saw a Facebook post about McCool. There's just so much information out there that people just skeet out information all the time. But you said you drove by the old McCool School and you didn't see any type of activity. Are you able to see the whole area from the main road there, Mayor?
No, just the front side. Yeah, I can see it. Of course, if there's anything going on, there'll be a lot of cars in the parking lot. But I haven't seen it. When Patty called me in the weekend, I drove by that same day, but I didn't see anything. But,
sorry, Sabrina, I called you over the weekend.
I mean, I'm sorry, not Patty. Yes, Sabrina. Yes, Sabrina. I'm sorry.
So you didn't see anything at all? Okay.
No, I went out there. I saw a couple of cars, but they, look like they're just checking the place out or what. But there wasn't heavy traffic.
Well, Mayor, they're going to have to quarantine 5,000 some sailors. I think they're already in the process. We saw a letter from the captain of the Roosevelt that says they're being housed in a gym on Naval Base Guam in cots.
That's what I inquired last night. We were talking. My son-in-law told me that, and even my daughter told me, yes, they're being quarantined on the shore, on the sea, by the ship, and those that don't are affected are up at the gym. But they said that they're not supposed to be out of base. That's what they've been hearing.
They're supposed to be pier side, right? That's
right.
At least that's what we
were
told.
That's what the governor told us. That the admiral told her was that they parked at the farthest dock, and that they were gonna remain pier side. Obviously, that's not even the case.
Yes, that's my understanding.
Mayor, how do you feel though? 5,000 sailors.
Are any of them from Santa Rita?
I'm sorry?
Are any of the sailors aboard the USS Roosevelt, are any of them from Santa Rita?
Not that I know of. I've been reading the papers and I see the Chamorro families and things like that, but I haven't, I don't recognize anybody, and not that I know of.
How would you feel though, Mayor, if we got to do things where they can't fit all the sailors, treat them all on Naval Base Guam, and they're going to start to maybe, use some of the facilities they have outside the base? Are you okay with that?
Well, I wish I could help them and everything, but I really don't want them on. I don't want it in my village, because of course I want to take care of my people.
For me, I just feel like, and I think we were talking about this in the break, that, they may be sailors and they may be in the military, but they're also human beings. And I think people should remember that.
Yeah.
And if they're all lumped into a gym, that obviously is not.
Yeah, that's on the military, though. I mean, if they don't know how to mitigate and control this situation, they're exposing these sailors. I mean, the guidelines are very clear. We practically know them by heart.
Mm-hmm.
So you're right. They are humans. It's so unfortunate that
and I just don't. I don't know. Are they going to be? Do they have accommodation to fit 4,000, 5,000 sailors on base in separate rooms? Because you're on quarantine. I mean,
well, that's not happening because the captain of the boat has said that they're in a gym and cots, and we don't know if it's 4,000. How many of them are there?
So, I hope today during this press conference, the governor will provide some answers. Maybe she's had conversations, as she has every single day, with Admiral Manoni and the commander of PACOM, Anderson Air Force Base, everybody, and find out. I just don't think that they're going to stay on base.
Right.
Yeah. Mayor,
I thought that they're going to stay on base and they're not going to be out.
And 20 of these people have family from Guam, are originally from here. So just be transparent.
Right.
Mayor, have you heard of any COVID-19 positive patients in your village while I got you here on the line?
No, I haven't, Chris, and that's why a lot of mayors in our chat too are, asking if they could at least name the villages so that, we could be on the lookout. I mean, it'd be nice if we know who they are so we could, really take care of the person. I mean, I can't heal them, but, isolate them more where it won't spread on my village.
Right.
So nobody in your village that may be COVID positive has even reached out. I know Mayor Savaras was telling us yesterday that there are 2 people that are on isolation, COVID positive, that have reached out to her, asking her if it comes to a situation where she or he, whoever the positive patient is, needs food, will somebody be able to help this person? And, she said yes. So nobody in your village who is positive has reached out to you.
Nobody.
No one.
We are delivering every day to our
Manamco?
Their food and homebound, people that can't get out.
How are they feeling, Mayor? I know the Santa Rita got a lot of Manamco, the Southern Strong.
Mm-hmm.
How are they feeling? What are they saying to you, Mayor?
Quite honestly, I mean, they're okay. I'm reading Facebook. They're bored. They want to play bingo, things like that, but they even asking me if they
You can do that on Zoom.
Yeah. No, David South are asking if, I can open up just for bingo. I said,
No.
But, I mean, they understand. I guess they just want to joke with me or what, but, I know they're bored.
Yeah.
But, what can we do? And I'm taking extra precaution when my people are going out, my staff going out to deliver. They're following all the procedures, masks, gloves, things like that, and just hand it to them on the door or hang it on their door. But, they're so far they're not that I know that they're not sick,
Right. Well, that's good, Mayor. You keep it in touch with them. We had 9 more positive cases last night, and sadly, a death of a 79-year-old man. So. And talking to Dr. Cabrera, who's on the governor's physicians advisory board, they're saying that we're 3 weeks behind what's going on in New York. So I know you read the news, you go on the internet, you look at what's happening in New York. That's really eye-opening. I'm kind of freaking out.
Yeah, me too. And I really hope and pray that we don't really happen here. But what can we do?
Yeah, well, there you go. Light a candle,
You
Mayor.
can stay home, wash your hands, use hand sanitizer, practice social distancing, and social isolation.
Yes, ma'am, but we're doing all that.
Do it some more. I don't know.
Do it harder, Mayor.
Yeah, my hands already feel so clean that I think they're peeling.
Mayor, I was just going to say, side effect COVID-19 times, I got lizard hands now because we keep hand sanitizer. Okay, Mayor.
Hey, thank you, Chris.
Okay.
Of course.
Okay,
All
bye.
right, there you go. Mayor Dale Alvarez, man. Yeah, I love Mayor Dale.
Yes, ma'am. Already, ma'am.
Yeah, already. I like that. I'm like, I'm kind of freaking out.
That
He's
sounds like a new promo.
Yeah, me
already.
too.
Do it some more.
Do it some more. Okay, let's switch gears here. We're still, of course, staying on COVID-19, but let's bring on Dr. Hoan Nguyen of the American Medical Center Family and Clinics. Doc, good morning. Doc, good morning.
Dr. Nguyen.
Hey, good morning.
Oh, there you go. Hi, good morning,
Good
Doc.
morning. Good morning.
So let's just get right into it. I'd shot you a message. We hadn't heard from you in a little bit. I was like, hey, I want to catch up. So the notice went out yesterday from Department of Public Health and Social Services that commercial testing for COVID-19 would it be available at the clinics, and it said effective now. This release went out yesterday morning. I guess first question: were the clinics told that commercial testing, or were the clinics told that it was going to be announced that commercial testing was going to be available at the clinics?
We had the advisory board meeting last night, and we really asked public health, and they should not release the memo out that early because there's no discussion with the provider in the clinic regarding that the availability of the testing through DLS. We know that DLS can do it in the past, but to have the clinic to do all the tests and without talking to us on the guideline and all that kind of stuff is really not the correct way to do it. The testing is not to free people to go back to work. Testing is basically to kind of identify, isolate, and contain the virus, and it will take time, like tracing and tracking the patient. Public health right now, I don't think they have the manpower to do that, and you have to kind of work out the issue with the insurance to see who's paying for it, because it will cost a lot. We have so many phone calls yesterday to our clinic to request testing, and a lot of them are not. It's not indicated, like testing to be free to go back to work, which is not going to happen. Because you can test negative one day, and you go back to work the next few days, you become positive. So it's really it's very dangerous to use it without any guideline. I know Medicare, Aetna, I think Netcare are paying for it, but they still not a clear guideline when the physician are testing. We, as provider, we test it very responsible, to choose who we need to test for. But now, if this is available to DLS, we will test more. Just say if you come in, you say I'm coughing, and you don't have a fever, more likely we're not going to test. You have to have some fever, some coughing, congestion, then we would test you, even you're 18, 20, or 60, just because we want to identify you and have the public health track you and tracing all your contact. But, a lot of people come in and say, I have a cough for 2 or 3 days or a week or so with no fever. To test all those people is really a waste of money, waste of test kit, and, it will cost a lot.
Doc, what I don't understand is that aren't you on the governor's physicians advisory council?
Yes, I'm one of the member there, but like I say.
So why weren't you guys given a heads up? I mean, I'm assuming that you guys are working closely with the gov and the administration and presumably public health for them to shoot out a memo and to tell everyone on Guam to go to their clinic and get tested for COVID-19. Without telling you guys about it?
That's a question we asked public health last night, and not sure they have an answer. We're supposed to work together, actually. We have a small group of physicians, 5 or 6 of them, that met for the first time the past few days to come up with a guideline, to come up with a subgroup that we'd like to test. And that's the right way to do it, because you want to target certain group, the old people that have to go back to work, the essential people, the healthcare worker.
So this would be the group outside of the limited priority group.
Yes, this is a group outside
Yeah.
the priority group. We have to target these people because those are people that are currently out working right now, and and the rest of the Romanians are supposed to stay at home, shelter in place, and not going out. So those not a target group that we want to target. So we come with a plan that will test a subgroup to try to isolate this virus, but that's what they need to be. But we haven't had a chance to discuss our public health yet, and they released a memo already.
Right. So, Doc, let me ask you, they released the memo yesterday. They told everyone on Guam, you can go to the clinic, you get tested for COVID-19. How many people did the American Medical Center family of clinics test for COVID-19 yesterday?
Yesterday we see over 100 people that walk in, and basically, we test very few still because, again, Christopher, if I test everybody, and remember, I have to submit the bill to the insurance company, and they might look and say, this person don't meet the criteria, the bill will come back up to you, and the question is, how much does it cost? We don't even know how much it costs, so the person we test will end up paying, $50, $80 for the test because the insurance will say, we're not paying for this. So unless the insurance come out with certain guidelines, which they supposed to, and that's their right to come with a certain guideline, we cannot test everybody. If you're a young person come in and you say, I want an EKG done, I got to get certain guidelines to get an EKG done for you, but we're not going to do EKG on everybody. That's not efficient.
Right. Doc, let me just play devil's advocate. If I have $50 to $80 with self-pay, I want to come in and take the COVID-19 test, because there are people out there who have the means. What's going to happen to those people? If they come in, they look fine?
Chris, as physicians, we have to be responsible for it. We would say no.
And what would the justification be for denying that patient that test?
That's why guidelines that we have to follow. Let's say that you have no symptom, and I test you today, and I take your money, and you are negative. And you come out and you go outside, you go to shopping, you do all kind of stuff. And the next few days, you are positive, and you potentially carry a virus there. So it gives people false sense of responsibility and security, and you go out and you infect other people. It doesn't make any sense.
Well, now that you put it that way, it makes a lot of sense.
This sounds like what's happening down at the USS Theodore Roosevelt down at Big Navy, where they're taking tests and people end up sick.
Doc, I got to ask you about that because I know you have been in the Guard, and you definitely have that military background. What is your take on this situation that's unraveling?
And I have to say, Dr. Nguyen, I remember when we went to the Philippines and you were part of the Guam Medical Association mission, and you led our group into I can't remember where in the Philippines, but it was deep in the Philippines.
That's in Tacloban.
Yeah, Tacloban. And
Tacloban,
you set up like makeshift hospitals, a makeshift clinic, and it was amazing. So when people hear your name, they should know that you come with experience in dealing with crisis situations.
Right. So that being said, what is your take on this situation happening right here on Guam with the USS Theodore Roosevelt?
I feel for the captain. They in the ship, there's so many thousand people there in the close confinement, and it's going to spread like wildfire. I agree with him. He needs to take his people off the ship and only keep certain amount of people essential for security for the ship and run the operation. But he needs to, just like he's saying in the letter, he needs to take everyone out. And I think in Guam, we gotta support them. They are our defender, and that's why our country is free for, because of them. So if they sick, we're gonna take all the hospitality and make sure that they take care of them, because without them, we won't be here.
Right.
So.
Doc, but is this and is there already a movement afoot for local doctors to somehow assist with the situation at the Roosevelt? We help them the best we can. We have to
get ready, just like Dr. Cabrera say. I mean, it's really, we have to be prepared because right now we feel like we way behind, and this curve will hit us like a tsunami, and we have to be prepared ourselves for the local population also.
Right. So that's what I was trying to get to, is if it reaches a point where we got to mobilize a local response to assist with the Theodore Roosevelt, where does that leave the local community?
I'm sure the federal government also a planning stage. They're going to have lots of people here on the ground, and some you got to look at the other way too. If they mobilize their active duty staff and physician and nurse to come to Guam to take care of the situation, they won't leave Guam. They will stay here and help us in the whole community.
Right.
So it's a plus for us, and it's not a plus. It's just an unfortunate thing, but it's also an extra help for our physician and our staff here in Guam that they will bring these people in. I promise you they will. They will take care of the people.
Yeah, I would think that they would. We just need to get some answers from the governor, because I think it's beyond.
It's beyond. Go ask the admiral. That I can't even believe that they.
Because you saw the letter, Doc, about how they were bringing the sailors into a gym, and now
I know. Yeah. And I read the letter last night, and
it was heartbreaking.
Yes. And I tell you, we have to open our island to help them. I'm telling you, after they will contain this very fast. This is the military; they move, and they have the fun to do that. And I tell you, afterward, the people that come here to take care of them will stay. They will not leave our island. They will stay behind and help our island. So we have to work with them.
Doc, having been in the military and served, what does it take for a man in a position as high up as a captain on a United States aircraft carrier to write a letter like the letter that we're seeing?
He just wanted to be transparent to our government, our people. I read the letter; it's very detailed, and I appreciate his letter a whole lot. It's nothing hiding there. They're very transparent to what they want to do.
Yeah, it's. People, if you have not seen that letter, go to our Facebook page, click the link, and you could read it for yourself. And as I said earlier, they may be sailors, but they are human beings.
Right.
And we have to acknowledge that. And it sounds like they need help.
They are our front line. You have to help them. I mean, as a local physician, and I'm pretty sure most of our physicians here and our staff, if we have the ability, we will come out and help them.
And there's all the talk about the U.S. Army Corps of Engineers also, and the offer that the governor talked about over the weekend to come in here, retrofit an existing facility, turn it into some sort of a COVID a hospital for COVID-affected patients. And then Dr. Cabrera also mentioned there was an offer about building, transforming a ship or a barge into a floating hospital. But then you run into, well, where are we going to get the medical staff to
staff 2,000 beds?
And maybe that's where the military might come in. I don't know.
Absolutely, Sabrina. That's what I was saying. I mean, they come and they take care of the people, and I think their containment and their plan are very good, and they will contain this virus on their troops, and they will stay here. Absolutely, I don't think they will pick up and leave Guam behind because they're here already. That's not who they are, and that's what their job is to protect this country. And they will stay here and protect us. So we have to help them.
Okay, Doc.
I hear you, Doc.
Yeah. Anything else you want to add? I know we started this phone call talking about testing. Commercial testing is available. It turns out, I don't know, you guys are one of the biggest clinics on Guam. Do you know if other clinics are running into the same problems that you guys are running into?
SDA and FHP stood up also. And they also want a center where the urgent care and everyone can walk into to be seen there. expect to load off GRMC and GMA. So those two clinics also stood up. So we try the best we can, but I tell you, we really like the mayor to stand up and enforce the shelter in place and ask the people to stay home. I think the majority of people kind of have a false reassurance, because I think if I look at the number of 30 tests and 9 positive or 1 positive, it's not the right curve, and we will hit that ceiling and we go up very fast.
I think what needs clarification in these numbers, especially from last night, are these 9 from the limited priority group, which are the healthcare workers, the first responders,
the elderly with symptoms,
or are they out in the community? You know what I mean? Because
Sabrina, for everyone to test positive, assume 100 of them out there is positive. Also, we didn't test because we have a limitation of the test. So I tell you, the key here is to think.
Yes.
You gotta think. Everyone around you is positive. That's the only way you can protect them, and you have to respect that, because if you don't take care of yourself, you gotta think about your loved one, the elderly around you, your neighbor. They will not be here the next few days, the next few months.
And I do think about them every single day, that especially when I'm away from my son. And I don't think it's too much to ask for a little bit of transparency from the Joint Information Center, from the governor, from the military.
You got to cut them a little break, because they're coming up with hashtags and doing little cute videos when they could be getting us information.
Yes, and they're trying.
And obviously, you're the physician's advisory doctor, whatever
You guys
group,
are in the
aren't
dark.
even informed.
I mean, you guys are the governor's physician's advisory group, and they're not even telling you guys anything.
There's some mistake here and then, but we try our best to do that. But like I say,
you got to do better, Doc. People are relying on you guys.
We're pushing out the best we can. The governor has the very hard decision.
But she does not make decisions without advice. That's why you guys are there. You're the physician's advisory group.
So are you guys advising the governor, or is it like her political people advising her?
No. We advise the governor, and she take our advice, the one that she wants to implement, and she has to weigh plus and minus for different reasons.
Right.
So we recommend something, and it's up to her to accept it or not accept it. We can't tell her hey, you have to do this. We just advisory group, which is to tell her that, hey, this is the best to do this, and she has to make a decision of follow our advice or not. So, but again, please, mayor, enforce and help your village and kind of lock down and encourage people to stay home. People wash their hands, wear the mask. We still see a lot of patients that walk in, just a few that have no mask. Wear a bandana or whatever, but you gotta cover your face wherever you go. So that's the thing that I say. But you gotta pretend like everyone around you that's standing next to you have COVID-19, and we will get through with this.
Thank you, Doc.
You're welcome.
Thank you for everything you're doing.
Right on, Doc.
Keep
Hang
on
in there.
advising.
Yeah.
Okay, thank you. Have a good day, guys.
Wash your hands.
Okay, bye. Thank you. I am.
Okay.
Bye.
Thank you.
All right.
Bye.
We got to take a break.
Yeah, we do got to take a break. And, the comments are blowing up. It's the first of the month. Rent, I got that grace period till the 5th. But this is what people are thinking about right now. And I want to go into the weeds a little bit on this because this is a question that, a few different media asked at the press conference yesterday. And so we're going to kind of look at what the governor had to say about it and read some of those comments out there. There was a comment here. Somebody had put, "We got to eat." And that's the reality. I mean, want to thank again Guam DOE for the grab-and-go meals. We'll have info about that coming up. But let's do news at 7:34, containing COVID. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Miss our daddy, Specialist Joshua Mansonotia.
I can't wait for him to come home.
Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Alpha Day Guam, this is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay home and stop the spread of the virus. Thank you.
Play this for my friends and family in the CNMI. We're going to be checking in with Tomas Manglotnia as things are very, very rapidly evolving in the northern Marianas.
That's right. News that flights are going to be canceled, suspended for in and out of the CNMI, effective, I believe, April 6th.
Right.
You'll still get mail, medevac, transport, all that's still going to be available. But flights in and out of the CNMI suspended effective April 6th through, I believe it was the 30th.
Right. So we wanted to kind of unpack some of this financial assistance stuff that the governor was talking about yesterday. This is really, apart from getting information on, COVID positive cases and the status of patients and everything that's going on with COVID-19, there's also people are hurting, people are struggling. People have to pay rent. People are out of money. People need assistance. People can't wait for the federal assistance to come down in weeks. And so that's what a lot of people are asking us to ask your elected officials. And so we did ask during the press conference yesterday, Governor Lulia Guerrero, if there were any plans and to issue any type of local aid.
A lot of people are out of work, been laid off. If they, I would think that if they had a choice if they had to pay rent or buy groceries, they're going to buy groceries because we've got a moratorium on evictions. But it will likely take more than just a few weeks, realistically, for money to come down from the federal government. Is there any local funding that's being planned to help? These folks between that time?
Yes, so Nestor, we do have public services right now. We have food stamps that they could qualify for. We have public assistance that they could qualify for. They can qualify for Medicaid. They're also getting tax returns out there. We've given out tax returns out there. So right now, currently, immediate help would come from those programs. Public assistance, general assistance through public health, the SNAP program through public health, and again, for healthcare, MIP, and Medicaid.
So folks who have been recently laid off are qualified now for SNAP?
They should go and apply for those. Yeah. We have the 311 number, right? So we have that. I think there's a extension for those kinds of questions. Yeah.
So call 311. Oh, weird one. I mean, you don't know what did Linda say yesterday?
She said
because it wasn't clear if the governor was telling all these people to go apply for food stamps, or if she was telling them to go apply for the disaster emergency food stamps. But that program,
they were trying to stand that up, and
that's not even working right now.
Yeah, she said she was working on that because we asked, you're going to see these surge of people that have been displaced, furloughed, they're going to need assistance. People that normally don't qualify.
Duh! Why do I feel like this is so hard for these people to understand? I don't understand. I mean, there's people out here hurting. And so let's talk about the governor and continuing to answer this question as talking about all the federal money that's going to be rolling into the island of Guam.
Money's coming down for not a direct rent payment to them, only that we are asking through our executive order to not evict these individuals. However, with these individuals that are unemployed, they will be getting the weekly unemployment economic benefits that we have through the pandemic unemployment benefits program. And so those dollars should be used towards rental payment. Helping also for prevention measures, surveillance, contact tracing, all of those expenses that we are incurring right now using our local funds and payments from our local funds. So what I wanted to do is have a better idea of all that's out there. What are our expenses so far? What can our local funding do? What can the federal funding do? So that's basically, I had asked her to let's regroup and let's look at this whole thing.
All right, and that's why they didn't have session. Is the governor said, hey, there's money coming down for this and money coming down for that. There's a lot of money coming down. Basically, to paraphrase it, Uncle Sam is going to make it rain on Guam. But it's not coming down now. That's the problem.
Right.
It's not. It's going to take weeks. We had a comment here. Food stamps and Medicaid are federal funds, not local funds. We don't even qualify. God help us. We need you now more than ever. There's a comment, another one here. We're not going to wait for the checks. At least release the emergency SNAP because people are struggling to buy food. Then there was another media that also asked the governor about rental assistance and if she was going to be providing any type of rental assistance. So let's listen to that.
Not a direct rent payment to them, only that we are asking through our executive order to not evict these individuals. However, with these individuals that are unemployed, they will be getting the weekly unemployment economic benefits that we have through the pandemic unemployment benefits program. And so those dollars should be used towards rental payment.
Weird one.
Dave Della Sola. He said there's no timeline.
There's no timeline. They don't even know how much
brand
money
new
they're going to get.
program,
Yeah.
and they're still working everything out. But in the meantime, they're asking employees and individuals who've been displaced, furloughed as a result of the coronavirus to email them so they can gather the numbers and the figures. And the email is rapidresponse@dol.guam.gov. And during the press conference, I think it was yesterday, he was mentioning that it's up to 2,400 or something like that
Right.
that he's aware of, but that did not include the tourism industry. And so when Mary Rhodes was on our show last week, she said that there were over 3,000 in the tourism industry alone. That number probably has gone up.
Right. So the number that I heard from Dave was that there are about 7,000 plus workers that have been affected through a combination of hours cuts, layoffs, furloughs, or even these business closures. We had a comment here from my buddy Jesse. During bad typhoons, we would get emergency food stamps to help the community. This is even worse than a typhoon. Why is it so hard to get the emergency assistance now? And to be fair, like Dave Della Sola said, they were kind of writing all this stuff on the fly. It just passed. That's why it's going to take weeks.
And the governor, the president signed the CARES Act just last week, and that's the $2 trillion relief package. And so, I don't know, the senators here on Guam, they thought they were going to go into a virtual session yesterday because there's all these bills that have been introduced to provide assistance, and
that was what the governor had said. She said that these bills, these assistance bills that she's referencing, I'm not sure which ones she's referencing, but that they're going to draw down on local funding sources. And she kind of, to be fair, I understand what she's saying. Let's get a handle on how much money we have, how much money is coming in. But you can do that. That's like you and the senators can have their session. They have their own authority. Well, apparently
they can bring
don't.
in DOA. They can bring
in committee of the whole. There's a way to do this
we'll all work together
in a more democratic and transparent way. We had another comment here from Teresita writes, "What the heck was that? Go apply for food stamps? Excuse me, Governor, but some people do not qualify for this assistance. You are not helping the people of Guam." Yeah, I kind of expected just a little more empathy from the governor, telling people to go call 311. I mean,
maybe everybody today call 311.
Yeah, so they're going to break 311. Yeah. That's what's going to happen. 7:48. Can we go over the testing, the results from yesterday?
Yeah.
From the Joint Information Center. There's just so many things happening this morning, of course. What I'm getting a lot on the WhatsApp are these national news stories about the USS Theodore Roosevelt. This is something we've been trying to follow closely for you guys. But, local Joint Region Marianas, I don't want to say they're not giving us a response, but the response they gave us was not really a response. Yeah. And so what we're getting from the governor and from public health is to go ask the admiral. We'll get to that. Of course, it's a hot subject, but first.
Okay, so the Department of Public Health, this was released at 9:55 p.m. last night. This is from the Joint Information Center. Public Health tested 31 individuals for COVID-19 on Tuesday with conclusive results. 9 tested positive through Public Health and 19 tested negative. Public Health's overall count also includes 4 positive cases that were tested by the Naval Research Center in San Diego. The total number of confirmed positive cases of COVID-19 on Guam is now 69. Again, 9 tested positive yesterday with a total of 69 positive cases on Guam. And then the governor announced during her media briefing on Tuesday that Guam recorded its second COVID-19 related death, which occurred at GMH. The patient presented at GRMC at the 24th and then was transferred to GMH on the 25th, where he remained in isolation throughout the week. Again, he was 79 years old with underlying health issues, which were compounded by COVID-19. He had no recent travel history, but initial investigations indicate The patient may have contracted COVID-19 from community contact.
All right, let's go to the phones here, 637-0094. Talking about people who are out of work, but Joe on the line here is working, but you're worried about going to work because you have an existing medical condition, Joe?
Yes, sir. And I got a old lady I go home to is dialysis. And where I work, we got a bunch of H2 workers. So is there programs for us if we don't go to work that would help us out, or? Because I'm scared to go to work.
Yeah, I feel you. And, construction has been deemed an essential business by the governor, so they've been granted an exception. Construction is still going. I don't understand how that's essential, but I feel for you, man. A lot of people have to work, so you basically have to go to work because you need the money, and you're worried about being exposed to COVID-19, and with your compromised immune system, since you have diabetes, even more of a concern is taking this home to your family.
Yes, sir.
What is your supervisor saying, or your manager?
Well, I go annual leave, so it's up to me. But then if I don't go to work, I can't pay my bills.
Yeah.
Right.
Everybody's caught in a tough position.
And now they're thinking about how long to pay people out for who got laid off. And I don't want to get laid off because I need to work. But
right, so
I'm here to come to work.
Yeah, I mean, you're in that gray area where, I mean, you've been impacted by COVID-19. Am I correct?
Yes, sir.
And how have you been impacted financially?
Well, I did check my check, and now I got to go buy all these stuff to try and stay safe. But it's just scary because they said this thing can kill me less than 14 days. I don't know. They said quarantine, but there's no cure, so what are they actually doing?
Good points. I don't know what to say to you. When you go to work, is your boss providing you with any, protective gear, anything to help mitigate the chance of you being exposed to someone who, hasn't been tested?
No, I have to go buy my own stuff to make sure because there's not enough for everybody.
Wow. And these are the things we're talking about. People some people haven't lost their jobs, but they are paycheck to paycheck, and we're spending money that would normally go to pay bills that are piling up in the meantime. So after all this is over, we're all going to be looking at several thousands of dollars in bills.
Yeah.
Right.
But the governor did recommend you call 311. Have you tried calling 311?
No. I just heard about that this morning on your station.
Right.
So maybe we should call 311.
Maybe the governor should call 311. I think the governor needs to call 311 and
Let's call 311.
Get the info out to the people. I mean, geez. 754. So, man, I feel for you. I don't know what to say. We're going to, we only get 2 questions. So, I mean, right now we're kind of like, are we going to ask about the Roosevelt because there's national news about that? Or are we going to ask about assisting the poor people who are struggling? Because we keep asking that question and we keep getting the same answer. Wait for Uncle Sam.
We can't afford to wait, man.
Yeah, I know. Glad you can laugh about it. I feel you, thank you, sir.
Thanks, Joe.
All right, thank you very much.
Yeah, I mean, there's just so many different sections of our community that are being impacted in different ways, right? I mean, not everyone has had their hours cut. I mean, we're fortunate. Not everyone has been laid off, but, people are continuing to incur these crazy costs.
Yeah.
You know what I mean?
I do, and I think we should call 311.
Okay, so we'll do that coming up here.
Okay.
754. It's the containing COVID takeover of Guam's favorite. We're going to do news, and we're going to call 311. And we're going to ask about what type of assistance is available for you guys. Okay, so we're KUAM-FM, Magotnia, Guam. It's a KUAM News takeover containing COVID. Good morning.
Howdy.
KUAM News.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Good day, everybody. I'm Sabrina Salsmatinati.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Stay home!
Ah!
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
The other filled with slow-cooked chipotle chicken. Two show-stopping flavors you won't want to miss. Introducing the Grande Burritos, only on Taco Bell's Cravings Value Menu. Value beyond belief. At participating U.S. locations for a limited time. Contact store for participation, which varies.
My late Pari, Sav K, two late great Chamorro artists on the track there with JD Crutch. Containing COVID. It's 8 o'clock. Let's go to the phones and get Fred. Fred, no? Sir, good morning.
Good morning.
Let's talk about this real quick, your situation. You went yesterday to get a grab-and-go meal, and what happened?
Yeah, we went, and it's the second time I went, and they had ran out.
Where did you go? Which
I went to FB in Jigo.
FB Leon Guerrero, Jigo, yep. That is one of the sites. What time?
And then I went around maybe 12:30, and they already ran out. So I went towards Weddingale, and Weddingale's line was just ridiculous. So I figured by the time we get to the gate, it's going to be 1 o'clock, and then there'd be no more or something. So I just ended up coming back home.
Wow.
Yeah. And also to speak on the behalf of what the governor had said, go apply for food stamp. She makes it sound so easy because she doesn't need to worry about it. We try to inquire about that too, and there's a lot of steps to take in order to even begin to apply for food stamp. They got to go out and get a lot of paperwork, marriage verification, and all those other things, and that's totally going against the lockdown.
Yeah, and the mayor's offices, a lot of them are on, they're closed.
Yeah. And the way they said, I didn't catch that news yesterday, but I'm watching you guys' live feed, and the way she said it is she's just winging it. Yeah, go get food stamp. That's not right, Mm-hmm. And the days go by, and people are getting more and more hungry, and I'm not saying I'm going to lead to violence, but a lot of other people will start to increase crime rate on this stuff,
Seeing the kids that are out there violating curfew laws, and who knows, some of them are breaking into homes because they're hungry.
Mm-hmm. Yeah, and it's just I didn't like the fact that she said go apply for food stamp and then called it 311. The 311's for the tax. I went ahead and I called that to see what's that about. And then I talked to the lady at the revenue and tax, and then she said that it depends also. People will be getting their stimulus checks, but it depends on something about when you filed your tax. So that goes to show that just not everybody might get their money.
Right, and so we're going to get Daphne Shimizu, a Reverend Tax, on the show here in just a few minutes. Man, I don't know what to tell you about the grab-and-go meals. I know that we had the superintendent on, and I know that they've worked so hard. They went from giving out, several thousand to 10,000 meals to 12,000 meals to include breakfast. So, I mean, they're meeting this need, and I can't thank them enough because that's what we need to see from our government. We need to see.
Yeah, I mean, I know they're doing their part, but the government
he's not even
put
in the
their
briefings.
The governor should do a little extra to ensure that there is enough. Get out and put the footwork in. Don't just go to a press conference and look like a retard and say nothing but and can't even answer a question properly. It's really not good. She's really unprofessional about this whole thing.
Yeah, I don't think and I think the real problem is the lack of compassion and lack of empathy to actually say, go apply for food stamps. And I think there's a 311 number that you can call. It just
that 311 number is only revenue and tax, and then you got to call public health for that assistance.
Wow,
maybe
311 made it sound like it was, a 411. All your info, come on, bring it on, 311. I mean, they made nice, fancy graphics. Like, come on, everybody, call. Unbelievable.
She's just winging it. She's basically the way I feel about her. She's unprepared for all the questions you guys throw at her.
Yeah, that's why we're limited to only two questions.
We only get two.
She's choking in the middle of the questions. She should better prepare herself for this. She should be on all the news just as much as we are, so she can have some kind of sense of a better way to answer questions.
Right, or how about...
She's under a lot of pressure. She's
yeah.
making a lot of...
I mean, this is the life she chose, though, Bree. This is the life she chose.
I'm just saying, though.
No slack.
I'm just saying.
Cut her no slack. This is what you signed up for.
Yep.
You wanted to be our MAGA hogger? This is what falls in your desk.
It's not just all, parties at Government House. There's a real work to be done
parties, here. Shaking hands, going and enjoying some money, whatever, this and that. When there's a crisis, you got to be ready for it. This is exactly what they signed up for.
But this is an unprecedented crisis.
Yeah. No, we get that. I mean,
I'm just saying this is what, they would respond. This is something like this. It's happening all across the world.
Yes, right. That's why they say adapt and overcome. We cannot give her slack. She's under this pressure. You have to adapt.
We're under this pressure, man.
Yeah.
We're under this pressure out here.
Pressure because we're broke. Okay. And she has to adapt and overcome all of this. She has to find better solutions, better ways to do things, and better ways to say things.
Right, or how about this, my friend? If you can't say things that are better, if you don't know how to answer the question, the governor has competent people on her team.
Yeah,
let them
appoint them to
shine. Let
answer
them
the
go up
question.
and answer. You know.
Exactly. Yeah. Just let her watch enough of a Trump speech, and Trump does that same thing. He has a lot of professionals behind him, so he doesn't get choked up in the question. He calls one of his professionals up to answer the question professionally.
And then they answer it professionally, and then he goes on after and disagrees with everything they say.
And then points fingers and then says the press is bad.
Anyway, man,
Well,
I feel for you.
Yeah.
And you're going back to the meals thing. All
Today?
the locations are like that, and we're going to give you all the
Big
locations.
ups to them. Big ups to them. They're doing as much as they can.
And I think they're providing an example. This is a need that they saw right at the beginning, right when we got the 3 COVID cases. This was something that and I just really wish that we would see the same concerted effort on the governor's side.
Yeah, but it's all we can do is just pray, man.
Yeah, light a
I
candle.
just hope everybody out there doesn't resort to crime and doing wrong things. Because I'm watching the news, and a lot of things in the state side are starting to go a little bit hectic, and I hope it doesn't happen here.
Right.
We all hope it doesn't.
I really hope everybody just keeps the faith and hopes that our governor makes moves before it comes to that.
Yeah, I agree. I mean, we don't want the governor to answer questions like this. We want, we want her to do the right thing. Of course.
Yes.
Okay. Hey, thank you, man.
All right, you guys have a good one.
You
Okay,
too.
take care.
Okay, can we get those grab and go
Yeah,
locations?
grab and go, and they did actually add on a school for up north. So it's a Stumbo Elementary School, FB Leon Guerrero Middle School, Maria Ujoa, Weddingale Elementary. For Central Guam, it's Agania Heights Elementary School, Carbolito Elementary, George Washington High School, John F. Kennedy High School, and Jose Rios Middle School. For the southern part of Guam, it is Inarajan Elementary, MU Lujan Elementary, and Southern High School. And again, these grab and go school meals program were made possible through a waiver which was approved by the U.S. Department of Agriculture. It is for children 18 and under to include children from both public and private, and it is available Monday through Friday except holidays from 11 a.m. to 1 o'clock in the afternoon. And according to the Joint Information Center, to date, the Guam Department of Education has distributed roughly 50,000 meals to students and families. And just to point out that the whole grab and go program is on a volunteer basis with DOE employees
and other agencies,
I think
partner
mayors,
agencies, mayors. I think DPW is also involved. I apologize if I don't name the agencies because I really want to thank these guys so much. So just to everybody who is involved with this grab and go program, which is something that we can't take for granted on Guam because they canceled it in the NMI, except for Rhoda. You know what I mean? So I think this is something that, and that's why I keep saying this, something we need to be really grateful for. Because in Saipan, people are going hungry because they couldn't find people to volunteer and to put themselves in a place where they're risking exposure.
And in Saipan, it's 2 confirmed cases. They're waiting on confirmation from public health on the suspected COVID death, which was announced Monday, I believe, in a press conference via Zoom.
Right. Let's go to the line here. We have Daphne Shimzu from Rev Tax. I know a lot of people are asking about tax refunds and just a whole bunch of right. So good morning, Daphne.
Hi, good morning.
Good morning.
I guess just first of all, if we could just start with the stimulus checks because that kind of seems to be on everyone's mind. I know that Rev Tax, because of the way that they're going to be distributing these checks, is involved. Can you kind of walk us through that process?
Absolutely. So, thank you so much again for having me on this morning to talk about what's called the Coronavirus Recovery Aid, Relief, and Economic Stability Act, and people are now referring to it as CARES. So I know that this is a hugely important item or of discussion for the community. And in the act, it's actually referred to as the 2020 rebate recovery payment for individuals. So we're also calling it stimulus. So some of the basic provisions I'm sure that people have heard about are income thresholds. There are $2,400, $1,200 payments for people who file married filing joint or head of household. Married filing joint is $2,400 for head of household, and for single, $1,200. And Of course, there are phase outs for the threshold for that is $150,000 for married filing joint, $112,500 for head of household, and $75,000 for single, and for $500 each for each eligible dependent. And if you've already filed your 2019 or 2018 tax returns, there's really nothing additional that you have to do. Your data is already in our taxpayer database at RevenTax. And again, if you have not filed, we've actually, we still have our Dropbox at the Aragata office if you wish to file in that way. If you file by Dropbox, we are requesting that you please make sure, just like if you were, filing, when you come in and walk into our customer service area, when we're open, that you bring an extra copy and make sure that you have both your copy and the government's copy so that we can stamp and send them back to you. If you want us to mail it back to you, you can actually include a self-addressed stamped envelope. But if you want us to contact you, which I really recommend that people do, is that they put their contact information, their name, their phone number, and their email address, so that once we're ready to provide those back to the community, that we're able to contact you and let you know. So you can file your 2019 returns online as well. Right now, we have a bit of a limitation in terms of what could be filed online for income tax returns. You really can only file those taxpayers that have only W-2 or 1099 information can file, and you can't currently file if you have dependents. There are things that we're looking at right now in terms of trying to see how we might be able to do something to help, most especially to try to support what's going on with regards to prevention of the continued spread of the coronavirus. Mm-hmm. So those are things that we're looking into in our IT side. But you could always file at our Dropbox. Also, if you need to make payment with your tax return, you can go to the Treasurer of Guam, and I'm grateful that Treasurer of Guam has actually been open throughout this entire period at the ITC building. And so, and those are the basic things that I hope that people needed to know. Were there questions in particular that you guys had about the stimulus or the recovery rebate payment?
Right, Daphne. I just had a comment here from JD writes into our Facebook feed. What if we're still being billed from GMH and there's a claim against us? Is the stimulus check going to be garnished?
As far as I know, as we read the act, the only garnishments that will be applied will be for child support. Even if you have a tax due, a back tax due, or so our local government, those will not be garnished. So again, as far as we read the law, what's allowed for in terms of garnishments is only for the child support payments.
Daphne, so basically you said if we filed our taxes this year or last year, all we really got to do is
sit back and wait.
Is it going to come from the states, or is it going to...
Is this local money that's paying for it and then we get reimbursed?
Well, so historically, and I think that if you just kind of look at our history, how it's always worked is that it's really been DRT and our local government that has, printed checks, and it really makes most sense that we would print the checks because we house all the data here. We have been actively in discussions with our federal counterparts, even in the last several weeks leading up to the signing of the CARES Act by our president. And then most especially since it's been signed, we've been corresponding with them through the weekend, studying the law. We met with them just the other day as well, and we have another meeting with them this week. So, with regards to, the CARES Act, there are still certain things that are being discussed in terms of the implementation, but the expectation really is that, and the discussions have all surrounded that the payments will be, definitely cut out of Guam or out of our DRT account, or out of DRT if there are checks that are being printed.
Daphne, how much money do you guys have a ballpark? So it's $1,200, $2,400 for couples. How much total money are we talking about that the residents of Guam are going to see?
In terms of the total amount, that's something that our team is still working to estimate and address. And of course, we have to work with our federal counterparts as well on working to develop an estimate so that way those can be funded to our government. But that's something we don't currently have, but we're definitely working on And again, I have been mentioning that, in the CARES Act, there is a provision which states that the Treasury itself has 15 days to report to the Congress on its implementation plan for its plan for how it's going to be utilizing the funds that have been appropriated for this program. And so, there's still a lot of things that we're actively discussing with our federal counterparts. And as we get those information, we'll definitely be sharing with the community. We want to make sure that everybody is up to date and is aware of all of those provisions.
So when was this signed again? This was last week. So 15 days from last week, the U.S. Treasury has to report to Congress.
Right.
So that's another 2 weeks.
Right.
And then once that's reported to Congress, then DRT can start cutting the checks.
Well, so even I think stateside, although all the guys, even nationwide in the news and the things that I've read from the IRS state that the hope is that within 3 weeks of the signing of the act that there will be payments. It's really unclear as to when. I don't know. I mean, like the full timing. Of course, I can't imagine how many checks the IRS themselves or direct deposits that they're going to have to make.
Right.
But the start of it on stateside time is about 3 weeks. When I was mentioning with regards to the implementation plan that's supposed to be provided to the Congress by the Treasury, again, they have 15 days. I don't know in the meantime or how long it will actually take. It could take less time. But in the meantime, we have been actively communicating and reaching out to our federal counterparts. We have not been, waiting for them to reach out to us. We recognize this is an important issue, and on the Guam side, just like with the IRS, they have actually mentioned several times, and it's even mentioned in the CARES Act, that these payments, they really need to be processed and paid out as soon as possible, because our Congress, our government recognizes the needs of our people. And so those, we're going by that guidance. The IRS itself, there are campuses that are across the nation because of the current COVID-19 situation that are closing. I know the Philadelphia campus is closed. The Washington, D.C. campus is closed. And then, as of last week, at least I believe the Austin and Ogden campuses were still open, but there was potential for them to be closed. The IRS themselves, when they say they're closed, they're not even going into the office at all to check mail and things like that. So they're only receiving correspondence via e-fax, and they're as they telework. So it's difficult to tell. Again, on the Guam side, and just like on the federal side, we are going to follow the law, and the law says that we must get them out as soon as possible. And our team, has been reading, reviewing, studying, working to make sure that we have a plan in place so that we can get these payments out as soon as possible to our people.
Daph, go ahead.
No, I just wanted to make sure it's tax 2018 and 2019, correct?
Right.
Okay.
So
go ahead,
the way
Daphne.
that the law reads, if you don't mind, the way that the law reads is that we utilize 2019 as a base, but if you haven't filed a 2019 return, you can use 2018. And so, again, for those individuals who have already filed a 2018 return, and if your status in terms of being married or single or head of household hasn't changed and your AGI hasn't changed, then really there's no need to rush to do or to file a return because your name will already be on the database, and the amount of your stimulus check should be, again, as long as there's no additional changes to your AGI, to your status, to your number of dependents, then there shouldn't be an issue with regards to your payment or how much you get. If you have not filed a return, a 2019 return, like I mentioned, you can file at our Dropbox or file online if you qualify to file online. And we're, again, working to try to figure out how we can expand our options so that way we can make it easier for people to file.
Daphne, I just got a tax refund question. People are wondering about tax returns. I think we just released October, right?
I know some came out will be mailed out this week.
Right. So where are we with, like people who filed in January? I know they probably need it. So how do we juggle getting out the tax refunds with possibly paying out these stimulus checks?
Well, I mean, the role of rev and tax in terms of refunds, and I'm sure you're familiar with the permanent injunction, and that final judgment was issued by Judge Consuelo Marshall back in 2013 as a result of a class action suit. So with regards to the permanent injunction and the final judgment, you know, rev and tax is required to make sure that we have and we process and print out checks within 6 months of the due date or the deadline, whichever is later. And so on our side, that's our charge, and that's what we make sure that we do. And so actually, and you can always find the tax refund status on our website, www.guamtax.com. It'll state exactly what's in the releases that go out. It'll indicate how many refund checks have been have been released or mailed during the week, and how much the total is for those checks. And it also indicates what period the file date is through. So for this week, we actually will be issuing or mailing out checks for error-free returns that have been filed through October 19. So we're a little bit ahead of the 6 months at this time. But you know, in this past year, I'm proud of the fact that we've worked very diligently to make sure that we're consistent in terms of the way that we pay out. When I started back in March was when we started making sure that we were consistently processing, I think, on a weekly basis and communicating to the community, because we recognized that there were so many questions regarding tax refunds and uncertainty about when things were going to be paid. But I think because of the consistency in payments, you know, generally people will know approximately where we are if you're following it week to week.
Right.
And if there are questions still about refunds, so say, you know, an individual says, okay, I filed through October 19, I've waited through the week, and I still haven't received a refund. Is there something wrong? We still have we have on our website a contact us section. You could always get online at guamtax.com, go to the contact us section right at the bottom left corner, and submit your question regarding that. And we actually also have our PIN administrator, who is our acting income tax supervisor. Her email address is pinadmin, that's PINADMIN, at revtax.guam.gov. And she's actively monitoring our mailbox and corresponding with taxpayers. I was talking with her the other day. I was trying to talk with her the other day while she was communicating with taxpayers. So even though Rev and Tax, our agency, is actually shut down, we're still working to do our best to provide the best service that we can to our community. But with regards to refunds, that's really where we are. And again, I'm grateful that we've had a good relationship with DOA and have been able to work very well with Director Byrne to make sure that we're consistent as we process returns, and that we always make sure that we are actually in line or working in line with and not violating the permanent injunction.
Daphne, I understand with the injunction in the 6 months, but what people were asking is there any effort afoot to pay out any refunds earlier than 6 months because of the situation that a lot of people are facing?
Well, as I mentioned, I think we're actually a couple weeks early. If you count from October 19, really these, if we were going to be on time or just within the 6 months, these would have been printed and processed in the week of April 19. So we're really at April 1 right now. So actually, we are a little bit accelerated in terms of the plan to try to accelerate. That's something that I'm not aware of at this time. On the Rev and Tax side, again, our charge is making sure that we process, that we can stay on top of and make sure that what we do is in line with the law, and that's what my team ensures that we do.
Okay. I wanted to ask about motor vehicle registration, because people actually have been asking about that. And if you could tell us what's happening with the DMV.
Sure, absolutely. So, yesterday we released our second volume in our COVID-19 services series. And, we actually issued our first volume, which covered several services back in March 18. That was Volume 1. Yesterday, we released Volume 2. In Volume 2, we made updates to our services and to other items based on making sure that we reflect any changes due to the additional executive orders that have been issued. With regards to motor vehicle registrations and driver's licenses and business licenses, we actually try to keep the same, the same deadlines and the same criteria. So with regards to registrations expiring in March and April, if there are vehicle registrations which expire during those months, they'll be extended through May 31. Any late fees will be waived for those period as long as the renewal is done by May 31. And this applies as well to renewals for driver's licenses and Guam IDs, and also business licenses. And if we do have a COVID-19 section on our website, so if anybody has questions about any of our services, we've done our best to try to identify those things that we thought people would have questions about. Our COVID series Volume 2 is actually like 5 pages long, but we did it. It's like it's an outline format. We've tried to make it as easy to read as possible. We've kept with regards to those things that we updated, we've tried to keep the template. I mean, if it was item A in the Volume 1, it's also item A in Volume 2. So we've tried to keep some consistency for the ease of our taxpayers and our community in making sure that they're able to cross-reference and to tell if there are updates. So again, if people refer to Volume 2, they'll be able to see that with regards to motor vehicle registrations, those have been extended. There's nothing that they need to do. They can try to, if they are able to renew online. And, we're really doing our best to support the social distancing efforts by trying to encourage everybody to do things online as much as possible. So if you've already done online registration before for your renewals for motor vehicle, you'll be able to do that again. And if you run into any issues, like I mentioned, those things can be resolved through our website, at our contact us section of our website, or through our PIN admin person who will gladly assist our taxpayers.
For people who don't have internet access, is there a hotline, or do they just call 311?
Actually, 311 is the best way. So what happens is, I believe when 311 is called, then they get patched over to our line at Rev and Tax.
Okay.
But again, I'm very pleased. Our team, again, we have a great team, and they're so willing and wanting to and desiring to help the community. Our team was fielding so many calls, not just on the 311 line, but also, contacting taxpayers who had communicated with us through the website, or through our contact us section of our website, and through email to our PIN administrator.
Okay. Right, Daphne. So the 311, that's not like a public health affiliated line. That's a Rev and Tax line.
I believe that the way 311 works is that it's and I could be wrong. It is. The way I understood it was that it was a triage for any. It was a place where the calls could be forwarded for any particular purpose. I don't believe that it was specific to public health.
Okay.
All right. So the website again is myguamtax.com, correct?
We actually have two websites, which can be a little bit confusing. We have a myguamtax.com, and on myguamtax.com, that's where we have the online portal for registrations for motor vehicle registration renewal, and also Form 1040s. Form 1040 filings, if you wish to try to do those online. Our guamtax.com website is for all other types of online services. We've separated it in that way, but you can go to either of the websites. They should have the same information. And again, all of the releases that come out from the Joint Information Center that relate to Rev and Tax, we actually have those on our website. They're not the Joint Information Center releases themselves. They're only specific to our Rev and Tax services. So if you want to know anything about Rev and Tax and what's going on there, you can definitely get on the website, and you can access it at the COVID-19 section.
Daph, just a real quick a comment here, a question about the stimulus. Would the people without a job who stay home, who are stay-home parents with 6 or more under Section 8, would they be included in the stimulus? Is it really just, it goes down to if you filed taxes in 2018 and 2019, right?
Well, and thank you for that question. It's a really, really great question. So there are individuals who actually who have not filed returns because they fall below the income threshold. If you fall below the income threshold, then you're going to have to file a tax return. Unfortunately, if you have dependents, you won't be able to do that online. But again, if you will be able to file utilizing our Dropbox, and so you'll have to go ahead and file a return. You could drop that at our Dropbox. We're working really to try to expand what we're allowing online. That's stuff that I'm hoping that we can, that we can get out to the community, because again, we're really doing our best. The IRS has an initiative called People First, and we're really trying to work and consistent with what the IRS is doing. They're really doing their best to reduce as much as possible any in-person contact, and not only to avoid exposure to our employees, but also to avoid exposure to the community. And of course, I was watching on NHK with my husband about these microparticles which stay in the air. So try to avoid any exposure to these microparticles and the possibility that people will become exposed to this COVID-19, which is again something that is quite scary. And so we're doing our best to try to contribute to the efforts to reduce exposure to that.
Right, Daphne. I know we had a little short convo yesterday afternoon about how seriously you take, sanitizing, and how seriously you are taking it for your employees.
Absolutely. For us, we actually have taken the initiative to do several things. One, and I'm grateful to Public Health and to our National Guard, we have been able to avail of some briefings and some of the information that they have. They've helped to provide our team with information on how to do decontamination, on how to make sure that they are safe when they come into the workplace or when they have to go out into the public, because as you know, we're still out working to enforce the various executive orders and to service the community. That's one thing that was hugely important. We actually, like yesterday, I made sure that I let the team know that we need to post signage around our building for those individuals that have to come in, and those people must, adhere to social distancing. They must make sure that, there's hand washing, and I'm very strict about it. I don't want to have anybody take. Hello? And I've actually, out of my own, because I know it's difficult for, people to get PPEs, I was able to, out of my own PPE stash, to provide some PPE.
Daphne, wait. Back up. You can't just say you have a PPE stash and we're going to let you slide on that.
No. Well, you know what it is my dad has been very ill.
Okay.
And so my brother, when he came to visit from Japan, had brought, several boxes of masks. And they're not the N95 masks. They're just the regular masks that at least prevent, some of the microparticles or, keep, things, liquid from, coming out of your mouth or your nose when you sneeze. So at least it helps to protect the people around you. And I believe it also, to a certain degree will help, you, because if you wear it, you're less likely to touch your face or your eyes, your nose, or your mouth. So, I suppose that in my life, I've tried to look at the positive things that kind of come out of things. I mean, even with my dad becoming ill, there were certain things that, resources that we were able to have that I had even forgotten that we had until I went into my dad's room to kind of help clean up some things. But I found a bunch of masks, and I was able to give that to my team. So, those things are very critical and important. The health of our community is very important, the health of the people at our agency and our people in general. And so that's why, again, it's very important. I know, and at this time, it's very difficult for the community. There are services, perhaps, like we are not able to do certain things like new business licenses and new registrations and new driver's licenses. But, we're really doing our best to help prevent the spread of this COVID-19. I take it very seriously. You will ask my team. I have been communicating with them. I've been really adamant that they do social distancing. I have, when I tell them, now most especially, I mean, I know, with regards to our culture, and most especially, I'm from the South, and, we're very, we get mamala. We don't like to hurt people's feelings. But I think now, most especially, it's important for us to be very straightforward and to let people know that, if you are coming into within 6 feet of me, I need to let you know, and I'm going to move back, and I'm going to advise you. And because it's really important, and so those are the things that we've done at Rev Tax again. And you're right, Chris. It's been very important for me that my team is safe, and also because, as you know, this just seems to be so highly contagious. Not just the team being safe, but also their families, because I would hate for anybody to be exposed to that, after coming to work at the agency.
You're reporting to work every single day, huh?
Well, so I've been in and out of the office depending on the need. We have people, again, who are enforcing they're doing enforcement of the executive orders. They've come in. We have people who have to come in and to monitor our drop boxes, to monitor our mail, to answer the phone. And those are important because, there are payments that still are coming in through the mail. There are payments that are coming in through our drop boxes. And our team, they very much care about making sure they are, taking care of our responsibilities and want to make sure they're staying on top of things. So we still do have some people that are going into the office. We are just not open to the public, and that's something that's important. If our agency perhaps was a little bit smaller, that may be a different situation. But because, the health and safety guidelines, right? I mean, we have at our agency about 180, almost 200 people. So there's no way that if we were even just open, that we would be able to meet the,
social distancing
and what's considered healthy in terms of guidelines, right? So those, and so those things are very important, and those are kept at the forefront as we work to plan how we do things, during the day.
Okay, Daphne. I'm not going to get into, you told me about your routine when you touch things in the office. I'm just going to say for our audience, you're very thorough. I appreciate that.
I know. Well, you know what? I know it sounds funny, but I'll tell you, when I go into the office, now I'm so mindful of everything that I touch. So, from the time I get out of my car and then I, touch the door to get into the office, I make sure I take note of which hand touches the door. So if it's my left or right hand, I'm like, okay, once that's exposed, then I only use one hand to open the door, and I use one hand to go and, do things. Then by the time I get to my office, I make sure, because I have these wipes on my desk, I wipe down my hands that were, both of them, and then I know that my space is generally not COVID, doesn't have any COVID virus that's alive anymore, and I'm very mindful of that. But I think everybody is, because of the way that the situation is, and I hope everybody is actually, because this is a very serious situation and honestly unprecedented, and really, I think a lot of times surreal. I think that I did mention to Chris that I had watched a show. I don't know what it was called.
I think it's Outbreak.
Maybe I don't know what the name of it is, but I know there was a little monkey who came into this.
Yeah, that was I think it's based on a Michael Crichton movie or book, Outbreak. Yeah, and then they quarantined the whole town, and the president wanted to nuke it. And
absolutely. So that was.
Don't watch those kind of movies, Daphne.
So that was before we had this COVID-19 situation. And again, it was it's something that you just don't. It's unfathomable. You wouldn't believe that would actually happen, but we're seeing it nationwide.
Do you make your own hand sanitizer? Just curious.
Well, you want to know something? So our team did go to they went to the decontamination training at the National Guard. And the National Guard, and so I was told by our team that, they did provide them with, guidelines for how to create a solution. And the solution they used, because I thought, okay, well, I need to make sure we either get it or, we buy it, procure it. And my team says, no, ma'am, they have advised that we use dishwashing liquid and bleach, and that should be sufficient. So, I know that we talk a lot about washing hands, but, even Public Health says, if you wash your hands, but you touch the knobs on the sink and you touch the doorknob, that might be a problem. So, we need to not only wash our hands, but I think bleach helps as well, because, who has time to wash their hands for 20 seconds? I'm sorry. I know that sounds terrible, but, I know that's the guideline, but perhaps maybe with regular soap. And I still do try to count for 20 seconds, but I think that, when you add bleach, obviously that helps to help, with regards to what it's able to kill. And I hope that public health, perhaps public health may correct me on that, but the solution that our team is going to be using is going to be dish soap and with a little bleach. And so then that way, as we're washing our hands, we just have to make sure that we don't get it on our clothes because it's going to cause some problems. But, at least we'll be safe and healthy.
Right on. Daphne, we
Thank
got to
you
run.
for that tip.
Thank you so much.
Duly noted.
Sabrina's just really happy she found someone else who makes their own hand sanitizer and who's taking this as seriously as she is. So.
Well, she's smart. Sabrina's smart. That's why I've
Yeah.
always admired you, Sabrina.
Thanks, Daphne.
Thank you, Daphne.
All right. So have a great day.
Thanks for everything you
Be
guys are
safe.
doing, you and your staff.
I tell you to wash your hands, but I think you're good.
Have a great day, guys. Thanks again.
You too. There you go. Daphne Shimizu, Reverend Tax
Very
Director.
thorough. She's very thorough. I really admire that.
Yeah, we talk about competent people.
Mm-hmm.
Sounds pretty competent. 8:41. Let's keep it going here, and we're going to bring Vice Speaker Senator Talina Nelson onto the show here. Good morning, Vice Speaker.
Hi, good morning, everyone.
Half a day.
First of all, how are you doing?
I'm doing well. I guess that's all that much can be said.
Right. Yeah, because I know you have some elderly who doesn't, and the family.
Oh yeah. Well, we haven't been allowed to see my grandparents, and so it's hard, but we want to see them around for many more years to come. So this is a small sacrifice.
Yeah. Well,
for them.
let's get right into it. So, were you disappointed? Were you anticipating to go into session yesterday? Or did you also find out, like Senator Taitigui found out through the media?
Well, boy, I guess I'd just be honest.
Hey.
That always works.
Because I don't know else how to explain it.
Right.
No, the speaker did give me a heads up before she sent out the letter that she wasn't going to call session. But in truth, the Committee on Rules and all of the other senators, we have been discussing ways to do it telephonically or, utilize the Zoom app to change our rules, during these, really precarious times so that we can continue the work. So, I was hoping that we would put these measures in place, and it seemed like we had a plan rolling out, and then I guess the speaker in her wisdom decided that she would not call session. But also there was some concern with the colleagues, which, they say that, well, what if the speaker calls in and then one of us gets sick and then that's the speaker's responsibility? I didn't entirely agree to that kind of argument, but I cannot control the way people think or feel, and so I have to respect the way they feel and how they're being vigilant, because even some of them take care of their parents who are elderly, and so those are some things that we need to consider. But we did have a plan in place to roll out telephonically. And
are you talking about Zoom?
I'm talking about going into session.
Yeah, but over Zoom?
Right, over Zoom or some kind of media app. And even in some instances, if some of our colleagues wanted to be present, they would spread out within the session hall. And, it'd be like a partial setup where some colleagues, if they wanted to be present in the Congress building, they would be there. And then they would also, those who would have to stay home because of their parents would be on Zoom. And so, those are just some of the things that we're looking at doing. Or all of us would just be on the Zoom app. But the call was made, and so now it's kind of like a stand down, and we're trying to figure out, okay, how do we continue to work now?
Right. So how do you continue to work now, Vice Speaker? The statement coming out from Speaker Tina Munoz Barnes basically said that, she's going to be collaborating with the administration very closely to kind of, I guess from what the governor had said, to kind of get an idea of where we are at with the local money and where we're at with all the federal money that they're anticipating is going to come into the island. But You know, one thing I noticed about you, Vice, is you never hesitate to go to bat for the little people. So I got to ask you, do you think that had your colleagues gone into session, you would have been able to address any kind of stopgap, measures to help our people who are struggling, who are being told that they're just going to have to hang in there for 3 weeks while we wait for federal money?
Yeah, so I honestly, this is I was talking to my colleagues and I was telling them, this is very similar to the war reparations bill. What's good for the goose should also be good for the gander, and people are already going one pay period without a paycheck, and so, half of Guam is shut down and people are hurting, and I just don't understand the reasoning on waiting any longer. People have bills to pay. Yes, I understand that banks are deferring, the government is deferring, but people struggle paycheck to paycheck. That's a reality that we face, and I don't know. Waiting 3 weeks for a package to come in doesn't feel comfortable for me. I don't like one bit of it. I think that, our government, we can supplement this until the federal money comes in. The governor invoked her executive right, and so she is working diligently along with her staff to try to make ends meet. And I believe, if we look to our local funds and help everyone on our island, our taxpayers, we could address this issue and reimburse the government funds, the general funds. It shouldn't be too trivial. We've seen it with the war reparations. Why can't we do it now to help, our population? Yes, it's a lot of money because we're seeing the layoffs, the furloughs, the cut in hours. But if we're anticipating on receiving this money, then we should just be able to, at this time, help the people, especially those that are suffering.
Vice Speaker, you said something very interesting there, and I was thinking about this last night as I was putting my head on my pillow. You're right. War claims, this is something that was in place federally. This was a federal program, and the governor and Democratic leadership and, a lot of your colleagues made a determination that they couldn't wait because, people were dying. People were... in the Manumku's case, it was more of a, we need to get them these checks right now. And I think the same argument applies to what is going on our island right now. But it's, it's not Manumku. God bless the Manumku's heart. It's more than Manumku. We're talking about, thousands and thousands of people. So, again, I don't understand why we could front money that was later going to be reimbursed by the federal government back then, but we can't do it now. And the governor seems very, very firm on this. It's we played some of the clips, and the response is almost like you ask about, is there going to be any local funds, and she's almost biting your head off. So I think that there is a parallel there with the war claims and what's going on now. And like you said, the precedent has been set. We did it then. People want to know, why can't we do it now? Say at $200, or we're not asking you to cut everybody a $10,000 check. We're just saying that the people can't hang on for 3 weeks.
Right, and they're discussing with my colleagues, some of the amendments we wanted to put in the bill would kind of safeguard the government as well, because once that federal money comes in, the government would cease funding the unemployment assistance, and the federal money would reimburse the government, and then the federal monies would then be activated to go assist all those that are suffering from this, the impact of COVID. So it's something that I cannot control, but I'm not going to fight about it because that's not what our community needs right now. I'm just going to continue to pray, and should anyone need my help, we're addressing constituent cases, and we're here to help.
What are your constituents telling you, Vice Speaker? What kind of help are they asking for?
Well, a lot of them in the beginning were worried about their evictions, and so that's being addressed, and I'd like to thank Senator Terlahi for that, because she did it in a very clever way where she was asking the support of the judiciary to ensure that our colleagues were, the people weren't being evicted. And so another was the payments on their utilities. And so, those measures were put into place to protect them so that they don't get disconnected. Some of it was in response to the health care being provided for their family members at GMH and GRMC. And so, we're just trying to address those and trying to find solutions with some of our executive counterparts. Yeah.
Vice, so, we're kind of wondering, is that it with the session thing? Is there any way that anybody can make a motion or, throw some votes together to go into an emergency session, or is it just a done deal?
Well, nothing is a done deal. The speaker has that authority to call session, and so, maybe hopefully we can move towards this Zoom app, because we have a lot of bills in queue addressing the COVID. But, in the letter, the governor did say to refrain from implementing programs that would be more burden to them. And so we're trying to find a way, like some kind of middle ground, that we can continue to move bills forward. Hope that things change.
Right. So the middle ground, I mean, right now it's basically my way or the highway is the way I look at it. It's the governor said, this is what I'm doing. Don't even bother getting together. But you're saying, I think the middle ground would be that, you guys do your job, do what people voted you in to do, which is, especially in a time of crisis is, I don't know, that's probably the time we need you guys most. So, I think that would be the middle ground, is the governor to kind of just maybe take a step back. And if the speaker doesn't want to do any bills or whatever, then, fine. But it looks like there are a few of you in the legislature who want to get to work for the people of Guam.
Yeah, there's quite a number of us.
I mean, is there more than 8? Is the point, though, Vice? I mean, do you have 8 of you guys, or is it?
Yeah, that's a good question.
Okay.
Well, things change by the minute.
Right. It's rapidly evolving, Vice Speaker. That's what they say. So is there anything else? I know that you had a bill that was out there for unemployment assistance. Are you satisfied now that we've been able to be included in the pandemic unemployment assistance program, even though we didn't have the unemployment insurance?
Yes, I'm very happy about that. And really, the work of our local Department of Labor, working with USDOL, they did an exceptional job to ensure that Guam could still receive that assistance. But the timeline really is what I'm concerned about, the timeline when the money is into the hands of the people. When will that time be realized? And we're not certain when that time is going to happen. So, let's just hope and pray that it could happen soon, because it's already been in one pay period that the people are going without a paycheck. And so let's just hope that we're able to receive the money by the end of this week.
Vice Speaker, someone had commented on our Facebook feed. They said you should fight about it. You said you were there to help, so this is your opportunity. You mentioned there are people living paycheck to paycheck, so do something. And that's what I want to say. I mean, I know that you're thinking that, we're in a crisis, people don't want to see fighting, but if you're fighting for the right thing, I think people can get behind that. And you believe that this is the right thing to have you and the senators come together and maybe push some of these ideas forward, because it shouldn't be a monopoly of ideas. And that's basically what we're getting now, is the governor said, this is how I'm going to do it. Stand down, legislature.
Yeah. Okay, well, I will continue. Well, I haven't stopped fight, in a sense where I'm not going to be divisive.
Right.
I continue to advocate for a session. I think I've become a thorn in the speaker's side. But no, of course, absolutely, I'm still going to advocate for that, but I'm not going to do it in a divisive manner where we come out attacking one another.
Well, I'll tell you, Vice Speaker, politically, you don't got to be a rocket surgeon to figure out that if, 8, 9 senators get together and say, oh, hell no, we're going into session, I don't care what you say, that looks good for the people out here. I'm just saying, that's the people out here, right now they're saying, oh, the governor's asking us to wait, who's going to help us? So there's a big void there that, it's an election year. I'm not saying that should be your motivation, but I just want you to know that there are a lot of people who feel like you guys should step up. So whether or not you decide to move in that direction, to hear those voices and to convince your colleagues, I guess we'll just wait and see, Vice Speaker.
Thank you.
Okay, God bless. Wash your hands, Kay.
Hazardous pay bill, Chris. We submitted the hazardous pay bill for our firefighters, our customs quarantine, our DOE employees, and private sector employees. And so we're hoping that, if we do come into session, we could also work on that hazardous pay bill.
Thank you so much for that, Vice Speaker, because I was thinking there was, God, and, Tia's going to kill me. I was thinking there was a reason why I wanted you to call, other than I really enjoy your perspective on things. But, yeah, let's talk about that hazardous pay bill, because there was something that the superintendent had said, kind of at the beginning of this, was that according to the pandemic plan, people are supposed to be getting some type of hazardous pay. So how does your bill address that?
So really it's to identify, those that are working directly with personnel, with people, like our staff at DOE who are handing out meals. Thank you very much for the great work that you've been doing. And, they come in contact with hundreds of people every day, and they're wearing proper PPE, but we don't know the complexity of the virus. And then even the private sector employees who are in the hotels where they have the quarantine, they're at risk as well. And our customs and quarantine officers, they don't receive any hazardous pay, and neither do the firefighters who are directly responding to these patients. And so really it's just it's really a small recompense for the enormous work that they're doing, the enormous sacrifice that they're making for our community and for our safety. And I feel that this is something just. I feel that this is something we can do to really, put our money where our mouth is and show how much we appreciate the sacrifices they're making. Because who knows, they're exposing themselves, and then when they come back home, they're putting their families at risk. And their families they understand the nature of the job that their mother or father, sister or brother does to support this COVID response. And, they're supportive of them. And so really this is just a way to tell them, thank you for the work that you're doing. And, we care about your well-being also.
Right. And I think, more than that is if you send people out to work in, in conditions that are hazardous to their health, they need to be compensated for it. And
yes,
so
absolutely. And that's a very basic foundation for any human resources proposition, to look after the people in that retrospect. So hopefully we can see something come to fruition there.
Right, and it doesn't look like you're going to get the timeline that you want with a session being postponed. Was it till further notice or indefinitely? TFN, right? So maybe something that could be enacted into law moving forward. I mean, that's probably going to be the best we can do with that, Vice. Unless, of course, you really persuade your colleagues to go into session. Well, good luck. Vice Speaker, again, we got to run. Thank you so much.
God bless you.
Bye.
God bless you, too.
Bye.
Wash your hands. 8:59, Guam's favorite. We got to do news. We're KUAM-FM, Agotni, Guam. Thank you. You guys share the Facebook feed. We're going to kick this show up a notch in the 9 o'clock hour. Get out there and hear some voices that we feel need a platform this morning. We're more than happy to give it to them. It's Containing COVID, the KUAM News Takeover, Guam's favorite, I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Hafide Marianas, this is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Hafide Guam, my name is JJ Ambrose. That's Juliet. This is Isabella, and that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends, I miss family, I miss going to the beach, and I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Guam's favorite, containing COVID, the KUM News Takeover. Let's bring Nestor Lecanto on here. Nesto, just give it to us. What's the latest with the Theodore Roosevelt?
Okay, yeah, this is breaking news. We just got off a briefing with the commander of the U.S. Pacific Fleet, that is Admiral J.C. Aquilino. So basically, it was about a half-hour briefing, but basically what he's saying is that they're doing all they can to, his top priority was the health and safety of the crew. He mentioned that he has been coordinating for the last 2 days with the governor and the government of Guam to utilize Tumon hotels to quarantine these sailors. He wouldn't say specifically how many at a time, but one reporter asked if he could confirm 1,000 sailors at a time that would be taken off the ship and quarantined. And then when they clear medically, then they would be returned back to the ship. In the meantime, they're going to clean the ship as, I imagine, as they take sailors off a certain part of the ship, they'll clean that ship, sanitize it. Once those sailors clear medically, then they'll be returned to the ship, and then the next group. I think one of his main points, because he was asked why not take them all off at the same time, clean the ship, and then put them back on board. And he said there needs to be a maintenance force on board, because this ship, the USS Theodore Roosevelt, in case anyone didn't know, that's the ship that's ported here, has 2 nuclear reactors. It has dozens of aircraft. It's got weapons, and it's got fuel. And they have to be able to maintain that, the security and operability of the ship. Another thing that he emphasized was that, and I think this was more geared towards enemies of the United States. He said several times, he mentioned that this ship, if it had to, is ready to respond to any conflict or action globally or in the Pacific. So he made that point a couple of times, which I thought was interesting, because that's where he's at. As the commander of the U.S. Pacific Fleet, he needs to make sure that this vessel, which is a key part.
This is a key ship, Ness. I mean, this is one of the most heavily guarded vessels in the United States Navy.
So he's got the almost unimaginable task of trying to weigh the health and safety of his sailors with the mission, which is to make sure that this vessel remains operational or capable of responding to any crisis situations within its area of operation. So that's the basics of what was mentioned.
Right.
Can you go back? Sorry,
Yeah,
I wanted if you could go back to
A lot
the
of questions.
1,000
Yeah, I know. I can
sailors.
imagine.
They were going to be quarantined or isolated, or what was that you mentioned about Tumon?
They have been in discussions for the last 2 days with the administration, with the governor, probably through Joint Region Marianas, I imagine, about using the hotels in Tumon to house the sailors that are going to be coming off the ship, so that they would be quarantined in the hotels.
So you mean to say that for the last 2 days, the governor and her people have been in discussion with the Navy about using hotels in Tumon for quarantine, but when we asked if they knew anything about the Roosevelt, we were told to go talk to the Admiral.
Yes, the Admiral, Admiral Aquilino is the one who said that. He said that they had been in discussion the last 2 days with the governor of Guam about that, and that, let's see, I got so much, and I'm not used to writing notes. I'm used to typing notes. So,
trying to read through your writing.
Yeah, okay. So this is the flow plan. This is what he said. The flow plan would allow them to take some sailors off. He wouldn't specify how many, although he was asked about a number, about 1,000 as the number, and he didn't say yes or no. They would be under 14-day quarantine or isolation. They would clean up the ship, I guess that portion of the ship where they were housed, and then put the sailors back on the ship. So that's the game plan. And so they need a place to house these 1,000 sailors at a time. And Tumon's got a lot of empty hotel rooms right now, so that would seem to be the logical place. The question for the residents is going to be, How safe will that movement of sailors from a naval base Guam
Pierside.
to Tumon, and how safe will they be quarantined? All of those safety precautions to ensure that that virus or the potential for them to be carriers of the virus doesn't leak out into the civilian community. And you know, I'm sure that's what is one of the primary things on the people's minds is how dangerous is it going to be for the civilian community, even though I get it. We support the military. We support the military, and you know, we want to ensure, and we feel for these sailors and their families. But we also feel want to be cautious about the civilian population. So, you know, it behooves our leaders and the military leaders to ensure that whatever movement of those sailors is done in a way that protects the civilian population.
Yeah, Ness, was there anything in that press conference about testing? Because, you know, right at the beginning of this, they said we're going to test all 5,000 sailors. Was there anything that they had said about that? So are we going to be seeing 1,000 sailors untested in Tumon quarantine?
No, they have been testing and they continue to test. So that will weed out who has contracted the virus and who hasn't. We will be able to, I believe, post that entire 30-minute press briefing on our Facebook site for people that want to, you know, listen to it at their leisure. And we'll be following up.
Soon this was going to start, this movement.
He said,
slow plan.
Oh God, he had a good quote there too, if I can find it.
Looking at Nestor's handwriting, you should have been a doctor.
Yeah,
I know.
exactly.
Put on my
He
glasses.
said he was asked about the timeline for moving to the hotels. He said, we've been working on it for a couple of days. The urgency has been highlighted, and when do you want to do it? As soon as possible.
Okay. What about the number of positive cases? Was there anything provided?
He would not discuss specific numbers. Similar to what we've been trying to work with JRMC, Joint Region Marianas Public Affairs, and they're and I can feel for them. I mean, we've been hounding them for information, and they just are not authorized at this level here to discuss it. And even the commander of the U.S. Pacific Fleet would not discuss specific numbers. So, but he did make the point repeatedly that any bad guys out there who are thinking of taking advantage of this situation, this ship is still ready to go. So don't even try it. Right? That was a clear message that he kept repeating.
But I mean, if they're taking 1,000 sailors off the ship, I don't even.
Yeah, he did not confirm that number, but he did not say no. He did not say no. He was asked that by one of the reporters, I think, from one of the national media. So, yeah. So we'll need to follow up with Leon Guerrero administration.
Well, you get one question, Ness. So is this going to be the question?
Yeah, I mean, it's difficult doing one question, one
follow-up
at a time.
what your question is now, so you guys can prepare for it.
Well, first of all, I think everybody's going to want to ask that question. So.
Or like what we've been doing, we've been trying to get that information indirectly. I'm sure maybe Mary Rhodes would be able to tell us if hotels are prepping for
I did want to ask you. They talk about bringing in any sort of medical professionals in the military to Guam.
Good question. Thanks for reminding me. Yes, they're bringing in some marine medical personnel to assist in this effort too. I'm not sure. He didn't mention exactly when, but hey, the Marines are on the way. The Marine medical.
Right, and so we talked to Dr. Hoa this morning, and he had said that if the federal resources get doctors here, get the medical staff here, and he thinks that they're likely to stay behind and assist somehow locally.
Yeah, and we also asked before about, and Joe and I shot. It just coincidental that the Cope North exercise involved what to do for field hospitals. They actually set up field hospital arrangements. I think in Saipan was one that we saw. So I mean that capability they just recently trained for. So I mean that's another option, I suppose.
Wow, so much going on.
So much going on, yeah.
So we've got the Marines coming in, medical professionals from the Marines coming in. The possibility that we're going, well, no, not possibility at this point, the reality that we're going to see thousands of sailors from the USS Roosevelt being quarantined at local hotels.
Yeah. And one of the other things that I wanted to point out is that this was all seemingly triggered by a very dramatic letter from the commander of this ship, Captain Crozier.
That's right.
That's crazy. That's what we've been talking about all morning, is that you had the captain of the Roosevelt write a letter basically help. I mean, yeah.
Yeah, this was a major SOS from this captain who is obviously very, very concerned about the safety and health of his troops.
And I don't know why we're not seeing that level of concern coming from our local government. I mean, if that's how the captain of the ship is feeling, and that's the response we're seeing from the Secretary of the Navy, and them trying to get this info out, we just hope that we can get more transparency.
And this is dated the 30th of March. Today is April 1st.
Right, so it's 2 days.
Actually, it's yesterday their time.
Right.
So, yeah, it was just yesterday that that letter went out, and it spread. I think the San Francisco Chronicle was the first one that got an exclusive, and then that spread.
And
And
it was on CBS News. That was the one we were reading this morning.
Yeah, and then when it got out to all the major media outlets, it forced the military to come forward, step forward, and tell us what is going on.
Yeah,
and that's all we really want to know.
You find that people,
they've been working on it for 2 days, so.
And people just want to know. I mean, you know, if good news, bad news, just tell us, and we'll deal with it. That's where I think right now is people just don't want to be kept in the dark.
And like I said earlier, they are human beings. And, you know, I know there may be people that are concerned, but we can't just leave them on the ship. I mean, come on.
Yeah, and we've got 20 of our own on that ship too, and all of their family and friends want to know.
Are concerned.
Are they safe? You know, what's going on?
And obviously not. If you read this letter, the link is on our Facebook page.
Yeah. Okay.
So.
Ness,
Right.
thanks. I know you're going to be following this.
I go back to sleep now?
Sleep? What? Sleep?
No, there's been very little sleep going on.
Thank you, Ness.
All right.
So again, that was Nestor Lecanto. He joined in on a U.S. Pacific Fleet conference call with media from across the globe, wondering what's happening with the USS Theodore Roosevelt. As you heard, discussions have been underway for the past 2 days with the military and the government of Guam and the governor about.
Well, what do you think of that, Bree? I mean, we've been really beating our heads against the wall trying to find out more about this Roosevelt issue. Only to have them defer to the Admiral what's his name and Admiral who's it what's it, and then come to find out that they've been negotiating the last couple of days, so they knew. I mean, is this just a case of where it's top secret, classified eyes only, and the governor couldn't talk about it, or?
Yeah, probably was.
You think so?
Yeah.
Okay.
But in the meantime,
I think the governor can.
I just feel for everybody that is on that ship.
Yeah, of course. And I mean,
I am concerned about what's happening in our community and the implications this might have. But, we're all in this together. The entire world is going through a crisis. And we just got to get these guys off that ship.
Right. And then, while we're talking about that, and, meanwhile, we have 69 cases outside the fence to deal with. We had a death yesterday. Mm-hmm. So, these new news and developments about the Roosevelt, I just want to be careful to not let it overshadow what we're all doing and dealing with out here. And it's tough, right, to dive into this and to cover everything that's going on with this. And in the meantime, COVID-19 continues to march forward on our island.
Mm-hmm. But you can call 311 if you have any questions. I did get a message from Crystal Paco San Augustine. So this is how the calls are patched through. When you call 311, it's the COVID-19 hotline. If you have medical questions, you press 1. If you would like to report a business in violation of the Social Isolation Directive, press 2. That's if, you know what, we'll post it up later. I think there's just way too much going on. The main thing that you should do is act like COVID-19 is everywhere. You have it, that I have it, and we shouldn't even be this close. But practice social distancing, use hand sanitizer, wash your hands, and stay home.
Right. Ken, we go through, we got some comments here. I want to thank you guys for watching our Facebook live stream. Ken's like, what? I'm not even ready. What are you talking about?
Yeah.
So, you know, and also I want to, maybe I'll do that. You got something to read, and I got to get somebody on the phone real quick.
No, I don't have anything to read. I can read the letter. You want me to read the letter from the USS Theodore Roosevelt,
Sure.
the Captain Crozier? If required, the USS Theodore Roosevelt would embark all assigned sailors, set sail, and be ready to fight and beat any adversary that dares challenges the U.S. or our allies. The virus would certainly have an impact, but in combat we are willing to take certain risks that are not acceptable in peacetime. However, we are not at war, and therefore cannot allow a single sailor to perish as a result of this pandemic unnecessarily. Decisive action is required now in order to comply with CDC and Navy guidance and prevent tragic outcomes. Problem statement. With the crew embarked, Theodore Roosevelt is unable to comply with CDC protocols or Navy guidance. Based on CDC guidelines and Theodore Roosevelt observations, the only effective method to preserve an individual's health is total isolation for 14 days or more, in accordance with Navy admin. For example, individual hotels, barracks rooms with separate heads. Due to a warship's inherent limitations of space, we are not doing this. The spread of the disease is ongoing and accelerating. Number 2, inappropriate focus on testing. Testing has no direct influence on the spread of the COVID-19 virus. It merely confirms the presence of the virus. Due to the close quarters required on a warship and the current number of positive cases, every single sailor, regardless of rank, on board the Theodore Roosevelt must be considered close contact. Testing will only be useful as the ship returns to work after isolation or quarantine to confirm the effectiveness of the quarantine period. Our focus now must be on quarantine and isolation in strict compliance with CDC and Navy guidance. Inappropriate quarantine and isolation. Again, this is from the captain of the USS Theodore Roosevelt. With the exceptions of a handful of senior officer staterooms, none of the berthing on board a warship is appropriate for quarantine or isolation. Thousands of close contact. Sailors require quarantine in accordance with guidance. Theodore Roosevelt has begun to move personnel off-ship into shore-based group restricted movement locations. Of the off-ship locations currently available, only one complies with Navy guidance. Infected sailors reside in these off-ship locations. 2 sailors have already tested positive in an open bay gymnasium equipped with cots. Although marginally better than a warship, group quarantine sites are not a solution and are not in accordance with current guidance. And this goes on for a couple of pages.
Right. And so, Bree, I actually have someone on the line here who was very close with someone on the Roosevelt, and they wish to remain anonymous. But we know you have some concerns, so we want to bring you up on the show. Good morning, ma'am.
Hi, good morning.
Let's just start at where you're at right now and how concerned you are for your friend on the Roosevelt.
I'm just home, and since they arrived, I've been on the phone with him every day. He's been stressed out. It's crazy in the ship, and I can see the distress in his face. And all he could tell me as of right now is they need help from the governor. They're being treated like they're a bunch of cockroaches in a box. And the way I see it, if the airline passengers were pulled to a bus and into a hotel to get quarantined, I think even they should be doing that, because like what you guys just mentioned, that's a ship with close contact. They use the same handrails every day. That's how they go in. That's how they go out. And how can you sanitize, or how can they have proper isolation proper social distancing when they're inside the ship. And the ship's, like you guys mentioned too, it's very tight in there. It's like it's a mess, and the troops are actually here to prevent Guam from from our enemies like China, but they also need our help, and I don't think they're being treated properly in there. Most of them are still healthy and well, but eventually they will get infected because of their living situations right now. And it's not fair. Some are staying in the gym, and mostly everybody are still inside the ship. So they need attention in there, Governor, and they even asked me to say, we need help from the governor. And yeah, I mean, I have so much to say, but right now I'm startled right now. They need help. Our troops need our help. They're humans too. They're people. They need to get off that ship and do things properly, just like what the CDC guidelines are. But they said that the governor's not really helping out, and I feel like they're being treated like a bunch of cockroaches. I think they're going to die from the COVID-19 before they can even protect us from any war or any other enemies out there. And they're in our territory, therefore I think that should be a main concern for the governor as well.
Yeah, there was a press conference just wrapped up with the U.S. Pacific Fleet. I don't know if you heard Nestor earlier. From what was revealed during that press conference and with the military is that they've actually been talking to the governor for the past 2 days about a plan to start moving these sailors off the ship and into quarantine or isolation in local hotels.
Yes.
When we're still waiting, I guess we're going to try and get the governor today, because as you may know, we've been asking about what's happening with USS Theodore Roosevelt since the story broke last week Friday. So
that's what they've been asking the governor to help them out, and I don't know what the governor is going to do about it. Right now, they're getting the impression that the governor is just going to leave them there.
I don't know I'm pretty sure the governor is going to say she doesn't have the authority to do anything to help them. I mean, but maybe what they are trying to do, and obviously this has been substantiated, is clear some hotels in Tumon for quarantine of sailors from off the ship.
Yeah, and those for at least the ones that are well still, that are not ill. You just gotta ask them. Okay, just like when I go and bathe, they ask me, Are you feeling ill? Are you coughing? Are you sneezing? I'm like, no. And then they let you in on base, So most of those sailors are still well. Send those sailors to the hotels, yes. Or maybe if they have family or relative who's willing to take them in.
Yeah, but ma'am, with the way this virus is spread, asymptomatic people can have it and they look fine, but they're the main spreaders. That's why this whole situation is not something we can just run downhill into.
Yes, just like the passengers then, that got off the plane. You can say everybody there, maybe it's, no symptoms, asymptomatic. Same thing with the sailors, but our sailors really need our help though. So what are we going to do about it?
Yeah. Well, hopefully we'll find out more information at the press briefing if the governor can provide us details, since they've been talking about it for the last couple of days. But we're going to be posting the press conference and the media briefing from the U.S. Pacific Fleet. It should be going up maybe in the next half hour on our Facebook page, and you can hear the latest information on what the military is saying, on what their plan is, their flow plan to get these sailors help.
Right.
Because
and there's also go ahead.
The more they stay in there, I'm telling you, the more they're gonna get. The more these numbers are gonna go up.
Yeah.
Right.
And I think the last count of CBS News was reporting that it was like over 70. And that's just the Theodore Roosevelt. We're not even talking about what's happening locally with 69.
it's going to be more than that.
Yeah.
I tell you that right now.
Right.
If they don't act up.
Some
they
of the
don't
comments.
separate those sailors.
Some of the comments here: move the soldiers to Leo Palace Hotel. Another guy writes in,
Yeah.
"No, the governor has enough problems she can't handle." Nadine writes, "Let's get our brothers and sisters off the ship and into an approved
Yeah.
quarantine isolation site."
Yeah.
And
These are our truth.
And you know, and during that press conference, they said, you know, when this plan rolls into action, we're actually going to see Marines come to Guam to help with the medical side of things.
That's good. That's good. People got to come together.
Well, we thank you so
Yeah,
much for
definitely.
your call. And,
You're welcome. Thank you, guys.
And I'll talk to you later today.
Thank you.
Okay.
Thank
Goodbye.
you.
Okay, take care.
Okay.
Okay. 9:30, containing COVID. Rapidly evolving situation with the Theodore Roosevelt Bree, and this is taking up a big part of our
morning day.
And we
Well,
we did some tests last night. Do we want to go over those results?
Oh, I thought you were talking like we did tests. Like, what kind of tests did we do? I'm kind of losing it here. Yeah, there was it 31? Ken, do you remember? 31 tests that were conducted, supposedly. Yeah, the numbers sometimes don't add up, but yeah. So 31 tests were conducted yesterday at 9:55 last night. Public Health or Joint Information Center issued their press release. So out of the 31 that were tested Tuesday, 9 tested positive, and that's through Public Health. 19 tested negative, but the overall count includes 4 positive cases that were tested by the Naval Research Center in San Diego. The total number of confirmed cases on Guam is 69, and then yesterday we had the sad announcement that we had our second COVID-19 related death. He was a 79-year-old man with underlying health issues and had no travel history.
Right, and so, we also spoke to Dr. Hoa earlier this morning about the commercial testing, and apparently there are some issues with them trying to figure out how this is going to be covered by the insurance companies, how those patients who don't have insurance are going to get covered, and also what's going to happen after they go out and test people, and in the event they test positive, how involved is public health going to be? So Dr. Hoa, who is actually part of the governor's physicians advisory council, had said that, the clinics didn't get a heads up. The public health shot out a press release and, said they're going to do commercial testing and everyone go to the clinic, and they just weren't ready.
Another one surprised.
Yeah.
To keep a running tally.
Yeah. He actually had told me last night that public health made a mistake in sending out that notice.
Yeah, he reached out to you, like, we got to let people know. Hold up,
I was like, wow, I didn't even have to find a guest. One found me.
I know.
So 9:30, we still got a couple things here to do to close out the show. Remember, we always try and end it on focusing on something positive. People who are maybe making sacrifices on their own end to be there for others, and that's how we're going to wrap it up. And I think if everything goes well, we might also be heading off island to talk with someone from Guam who's dealing with COVID-19 far from home. It's 9:33. We're KUAM FM Agotnia. Good morning.
KUAM News Updates are brought to you by
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Dynamic duo of dazzling flavors. It's the Grande Burritos. 2 burritos with one-of-a-kind tastes. One, a taco reimagined with crisp lettuce and crunchy red strips. The other, filled with slow-cooked chipotle chicken. 2 show-stopping flavors you won't want to miss. Introducing the Grande Burritos, only on Taco Bell's Cravings Value Menu. Value beyond belief. At participating U.S. locations for a limited time. Contact store for participation, which varies.
Let us help you celebrate those special people in your life on the Cold Stone Birthday Club. Weeknights on KUAM News Primetime, KUAM News Weekend Edition, and KUAM Radio. One lucky celebrant will receive a birthday cake from Cold Stone Creamery every week, and their lucky nominator will receive a gift certificate from the Cold Stone Yogurt Dessert Bar as well. Visit KUAM.com to register your celebrant's birthday. You must also send an email with the name of the celebrant and their date of birth, as well as a single close-up photo to birthdayclub@KUAM.com. All submissions must be compliant with KUAM regulations and must be received 2 days prior, but no later than noon tomorrow standard time on the day of the birthday on weekdays, and noon on Friday if a weekend birthday. See KUAM.com for additional regulations.
The Birthday Club is presented by KUAM and Cold Stone Creamery and Yogurt Dessert Bar.
Bridging the gap between you and your fitness goals is our main focus here at the Bridge Fitness. We are here and ready to keep you fit and healthy. If you're looking for a general physical preparedness program, personal training, strength and endurance programs, visit The Bridge Fitness on Instagram for our daily WOD updates. If you would like to take part in our program, email us at tbfguam1990@gmail.com for more information. Remember, Guam, stay safe and stay home. Bridge Fitness, bridging the gap between you and your fitness goals. Wendy's is open for business and taking extra steps to ensure your safety. All Wendy's locations will strictly operate through their drive-thru windows. Head on over now to try their local breakfast platters or their breakfast sandwich combos. And don't forget their bacon fried rice. The real deal for breakfast is at Wendy's. Now that's better.
Well, 9:50 9:40, Guam's favorite. So just kind of letting you know what we're trying to work on. We did put the ask in. I've been very difficult getting information. We understand it's a public health emergency and a crisis, but they have these press conferences, and we really try to get as many people from the administration and from the COVID-19 response on the show to answer questions, and a lot of them have been very accommodating. But we do these daily press briefings, and we get one question and one follow-up question, and look at how many questions people are asking us on Facebook. You're calling in. There's thousands of, if not hundreds, of questions. And so we, given these developments with the Roosevelt, we did ask the governor's communications director, Janela Carrera, if we could
get more than one question
today.
Follow up today.
And what was the response there?
I'll see what her schedule is like.
Right, so there you go. And hopefully we do. And the first press conference, it was a round of 3, so
yeah.
I like that one because all the media got and really it's not about like we want to grill you. It's just that people want to know, and you should be available. Especially if you've been telling us like you can't talk about it because the admiral this and the admiral that, and then come to find out that you've been meeting on it and it's everywhere in the national media. This is, I think, an opportunity for the governor and her people. Well, maybe that opportunity passed, but to kind of come out ahead, it's a little late for that. So I don't think that we should have to bang down their door to get some answers. They should come out ahead of this and be transparent. 9:42,
I wanted to say just a couple of things today before we get into our interview. The isolation facility at a local hotel that is opening today, according to Linda Pingo DeNorsi yesterday. So there's about 8 home isolation patients that will be moved into the isolation facility, and also there is a hearing today for the passengers that were quarantined that came in from Manila on the 19th. So that hearing, I believe, is at 1 o'clock in the afternoon, and so Linda Pingo DeNorsi is going to move that they remain in quarantine, I believe, until the end of the month.
Okay, and so we wanted to go over the phones. I was cruising my Facebook because a lot of people are sharing a lot of things about how they're dealing with COVID-19, and one of my Facebook friends, Christy, had posted here that, yes, I tested positive for COVID-19. Yes, it's scary. I'm definitely one of the lucky ones. My family kicked butt when things got real. Thank you to everyone who checked on me. Sorry if I didn't get back to everyone. I've been in and out of sleep. Can't wait to spend time with my family without the barrier and go back to work. I go. And in this post, she included a bunch of different videos. And I wanted to get her on the line to kind of share this experience. Good morning, Christy.
Good morning.
So you're calling from New York. You're out there in New York, correct?
Yes.
Where are you originally from? Here in Guam?
I'm originally from Anigua, Guam.
Anigua. Who's your family, girl?
Between the Regarios and the Cruises and the 10 Caps.
So what is your last name? Because I know your Facebook handle is Christy Marie.
Yes. My last name is actually Wolf Necklace.
Wolf Necklace.
Yep.
Okay. And so you tested positive for COVID-19. Can you take us back to what this experience has been like for you?
So I'm a nurse. I got it from work. We have been testing people since it started coming our direction, and just so happened that one of the patients got it. The scary part is that everybody has different symptoms. Some people have some people have none. And when all the employees on my floor started getting it, I got tested to be on the safe side, and then I was considered positive, and literally that day was when my symptoms started.
Wow. You said...
So it was like pretty much being guided through the dark, almost, it felt like.
So you're a nurse. You got it from where you were working at the hospital, right? Or the clinic?
Yes.
I'm sorry?
I work at different locations, but where I got it from was a nursing home specifically.
I see.
Well, people want to know. I mean, I saw your Facebook post. I saw the different pictures. How how sick did you get? And just share what this experience was like and actually having this virus.
So on social media and the news, people, they kind of only tell you to look for a fever, a cough, and a tightness in your chest. But I had more than that. Mine was more so the body aches. I can't smell anything. I can't taste anything. But I think the worst of mine would be the fever, the body aches, and the cold sweats at night. They don't talk about the rest of the symptoms that may go with it. They only talk about those top three. So a lot of people think they have the flu when you probably have the virus. So you're walking around. Yeah.
You're walking around. So when did you start to suspect that you needed to be tested?
I had an inkling last week, Thursday, because the nurse I relieved, she had to go home. She was not feeling good at all. And when she handed me the keys, I don't know, I just had this feeling that things were about to get really ugly, and literally it was like right from Thursday, it just went down. Coworker after coworker was testing up positive, and then come Saturday, I started to feel a little like indifferent, but I thought maybe it was just stress. So Saturday night, to be on the safe side, because I'm around my family, I need to know, I went and got tested, and then Sunday afternoon, I was told that I was positive.
Wow.
And then my symptoms started.
How did that work? How do you go and get tested?
She's a nurse.
Oh.
So it's really confusing, and it's very different. I'm a healthcare worker, so I call ahead and I let them know where I'm at. They ask me a set of questions, and if I fit a criteria to be urgently tested, then I'll get tested first. But also because I'm a healthcare worker, I get expedited. Instead of waiting so many days, it was literally the next day.
Were you, when you were working, were you wearing personal protective gear?
Yes, and I wash my hands so much that it sounds like sandpaper.
Mine are almost there too. So you took all the precautions that you were told to take as a healthcare worker on the front lines of this thing.
Yes.
And you still got it.
Yes, I did.
So can you give us an idea about your state of health? Are you how old are you?
I'm 31.
Okay. Are you pretty healthy?
I'm actually very healthy. I don't smoke. I drink very rarely. If I do, it's really definitely not often. I go to the gym very regularly. I run 6 miles at least twice a week. I'm very healthy.
Wow. And so, I mean, this virus took you for a ride, and, imagine the elderly, like, coming from a nursing home. Those people, this thing, it just runs through people with pre-existing conditions.
And, the crazy part is I had the flu about 3.5 weeks ago, and this is nothing like the flu.
Can you tell us, being in New York, we had Dr. Cabrera.
They say that's the epicenter.
Right, that's the epicenter right now. So we had Dr. Felix Cabrera. He's one of the doctors that's advising the governor on this COVID-19 thing. And I interviewed him the other day, and he said that Guam is 3 weeks behind where New York is now. Now, being in New York, what can we expect here on Guam?
It's going to feel like it'll get here when it gets here. It doesn't seem as drastic, but literally when it starts trickling towards you guys, it's just going to start to feel like panic. And everyone's going to be cautious of each other. No one's going to want to be near each other. It's like when I come home from work, I don't, like the past week, I didn't hug the kids, and it's just kind of like, don't come near me. It's just, you just kind of build up this little sense of guard. I would expect that the grocery stores will probably be empty. I would say get all the essentials, the Tylenol, cough medicine, heat pads. That's what I would definitely tell everybody, because luckily my family is just very on it, supersonic, so not everybody's like that.
Mm-hmm. So you isolated in your room away from your children?
I'm in, so we have a side room. It's kind of like a den. My family put up they got a big sheet of plastic from Lowe's, and they put it up. They covered everything. They took out anything that would, collect too much germs and stuff. And it's just me in here with a bed, a little leather couch that's easy to clean. I got a lot of fluids in here. There's a little bathroom that only I use, and I have a window, so I can open it for fresh air. But this side is my side, and I can see them from the other side of the plastic, and we just talk to each other.
Wow, and so this is something that we're coming across on Guam, is that when we're getting COVID-19 positive patients, they're sending them home for home isolation, kind of on the assumption that they have a bathroom. And so they're putting people up in hotels.
That's it. I thought that was a really good idea because they're actually equipped for room service and isolation and division between people. I thought that was actually a great idea. I think New York City's actually about doing it or not doing it already.
Yeah, I think it's in the Javits Center. It's like a convention center, I think, where the Army Corps of Engineers went in and they retrofitted the whole facility.
Tell us, New York, it's all over the news with Governor Cuomo. How bad is it there? I mean, you got your, boots on the ground, so to speak.
So I'm not anywhere near New York City. I'm in upstate New York. But just where I'm at, the roads are very bare. I'm not used to saying it this quiet. Neighbors are definitely not outside. The grocery stores are empty. There's no medicine anywhere. It's just very empty. Everything's closed. Restaurants are closed. The gyms are closed. Some of the schools, they're being closed to the end of April out here.
Have you been...
They have this thing called telemedicine, too, so instead of going in, the texts come to you.
Yeah, we have that. We got telemedicine, too. No, but what would you say, and how long is it going to take you to be kind of cleared of COVID-19? Because we're hearing on Guam that 7 patients have made a full recovery, but, and what I'm reading on the internet, just how fully recovered people who have had COVID-19 can be is, I don't know if that's still something that's up for questioning.
So I'm kind of on the fence. I'm not really sure. I know the Department of Health, they want me to be home at least 7 days, and then from 7 days they're going to check on me. My job, however, wants me to be home for 14 days. But the Department of Health here, if I feel good in 4 days, from 4 days on, I have to be no symptoms, no fever, no over-the-counter medication to help me for 3 solid days. If I'm good for 1 day and I start that second day, my 3 days start over, and I'm not considered clear until I'm 3 solid days clear of everything, all symptoms.
How many days are you in now?
So I started Sunday, so I'm only on day 3.
Okay, yeah, I can hear you coughing.
Well, I'm going to sanitize the phone for this. Do you have a message for your family here in Guam? I saw that you had a lot of comments on your Facebook post, and maybe not just for your family and your friends here, but for those people out here who are scared about catching this virus, which is so contagious. What would your message be to those people?
My message would be to just stay calm. It is scary, but prevention and being prepared is the number one key to getting through this. Be on the same page with each of and everybody that you live with, your family, your friends. Make a plan. Have a designated room for whomever's sick. Discuss who touches what, who doesn't touch anything. Kids stay away. Elderly stay away. There needs to be someone like right now, my brother's I call him the circulating nurse because he's the one that goes from room to room to make sure everybody's okay between me and the kids. And just have a plan. It's going to be okay. And it is scary, but if you're prepared, you'll definitely be okay with it. But don't feel like, oh my God, it's here, and then just kind of like run around like chicken with no heads. That's my best advice. Get medicine, get everything, so you don't have to leave the house, gas your car, just any little thing that'll distract you, because when it gets there, the last thing you need to worry about is those little things.
Okay.
Like even sit the kids down and have a family meeting so the kids know when uncle's...
I think we might have lost her. Yeah.
All right.
Okay.
Well, thanks.
So, yeah.
Christy.
Interesting. A nurse in New York. I'm sorry she said New York. In meeting Chamorro, I just think New York is New York. So I was like, I was in New York. She's like, no, I'm in upstate New York. I thought it's all the same place. 9:55.
Big news day.
Yeah, it is a big news day here. Are you ready to... You want to get to work in the back, or you got anything else to read out here?
I got nothing else to read. I mean, yeah, obviously I do, but it's time to go.
Yeah.
To decompress.
Okay. So, yeah, that's it. Containing COVID, the KUM News takeover of Guam's favorite. Obviously, there's a lot of information that we're going to try and track down for you guys today with this whole thing with the Theodore Roosevelt. It's developing very quickly. And then, of course, you know, in the meantime, we're also dealing with containing COVID out here as we're in week 3 of the governor's orders to shut down and shelter in place, mandatory social isolation, social distancing.
We are mourning the loss of our second COVID-related fatality. 69 confirmed cases, 9 overnight.
Right. And so I think, you know, we've had one of our worst days yesterday since this COVID thing started. And, you know, just remember, dig deep, guys, light a candle, you know, pray if that's what you got to do. And just know that in talking to all the people who are on the front lines of this, they're saying that this is just the beginning. As bad as this is getting, that we're going to start seeing, you know, cases doubling. And, you know, they're saying that we're going to reach that point where our healthcare system is going to be at that breaking point. So my advice would just to be kind of, I mean, it's so much if you just stop and really think about everything that's going on, from, you know, these sailors to two elderly, Manumko dying of this thing, to the, you know, to the government saying, assume you have it. You know, if you've been to any kind of gathering in the last 30 days, you probably have COVID-19. So it is a lot to deal with. So just take your deep breaths. And
I'm not going to say anything because I'm already pissed off at a lot of different things. And so, you know, from information, numbers that don't make sense, information that we're not getting, knowing that the governor knew about this for the past 2 days.
That's definitely
and we've been
frustrating.
Asking questions.
Yeah.
And we've just been deferred, and they just had a press conference, and here's the head of the U.S. Pacific Fleet.
But telling the real story. So, yeah, thank you guys so much.
And then to find out, we might have time. We'll see if we have time to if you can ask more than one question.
I mean, and you know what? I
people at Guam have questions.
Yeah, it's not the media. If you guys got a problem with the media, get over it. You know, don't take it personal. We're just doing the work of the people, which is what we hope you're doing too. Okay. Sabrina Salas-Mentanani, thank you so much. Air Rock, good job today. My name's Chris. I'm leaving you with Micah Manaitai, 957. We're KUAM FM, Agatni Guam. Adios.